Shall I get started? Or, yeah? Okay. Let's. Yeah? All right. Ready? All right. Morning again, everybody. Okay, so I'm going to a little bit of change from the schedule. I'm just going to do a couple more examples, like I did yesterday, and then I'll hand it over to Carmen and then Roger, and we'll continue from there. So I think we sent a paper for you guys to just look at, and the value of that, if you have your laptop, some of the tables I just want to show and discuss with you, and on the screen they may look a little bit small, so if you have that paper you can just look at it and see bigger if you need to see it. Okay. And just while we're talking about papers, so this is the iron supplementation paper, and I'll just talk through that study and use it to illustrate some of the points that we heard yesterday. I think before this workshop began, there were two other papers that you should have received. And that discussion, we'll talk about that discussion next week, probably Monday. And those you should read. This one is just for your interest, and you can follow along. So optional to read if you're interested. Of course, you're welcome to read, and we can always talk more about it. But the other two, do definitely read those. I know it takes time sometimes. They have two different arguments, and we'll just kind of talk about the scientific debate that is happening. It's about ultra processed foods and how it relates to obesity, which is a very, relevant problem for us in the world today. So that'll probably be Monday. So you have a few more days to just kind of look over those papers. Okay, ready? Okay, so let me start here. So the paper that you got was about iron supplementation. I think it's a topic that's, probably very familiar to many of you. This was one of the first randomized control trials that I was involved in as a statistician. And in other roles as well. So this is probably very familiar, but let me just make sure in case some of you are not familiar. So we know iron in pregnancy is very important. Anemia is very common as a public health problem, and it's especially important in pregnancy because it affects so many outcomes for both mother and the baby. And it has many causes. Iron deficiency is a very big one, accounting for maybe half of anemia in the world. There are other nutritional causes, there are non-nutritional causes. And so iron supplementation during pregnancy, because the maternal requirements for iron are so great, like it's just a standard of care to give iron during pregnancy. And this study, I think, I forget now when it was published, maybe 2015 or so, it's a little bit old. And the reason why it happened was this, so I'll share. So right now, the recommendations, and it's always been that when a pregnant woman comes, we give them iron. We don't test them, like if it's possible, people test for iron deficiency, they test for anemia, but regardless of what their status is, their iron status or their anemia status, they receive iron anyway. So it's not that you do a diagnosis of anemia or deficiency and then give iron or not give iron, everybody gets iron. So what happened is in 2006, there was a study looking at iron supplementation for children, looking at, kind of the benefits of iron and routine supplementation for children. And this was in Tanzania, in East Africa. And as they were doing their RCT, they found that the children who were getting iron actually had higher hospitalization and higher mortality. And so that made them very, concerned. And the study was actually stopped early. So once they realized that, they stopped the study immediately and they investigated it more. And what they thought was happening was that in Tanzania, there's a lot of malaria. at least in those days, it's better controlled now, but there was a lot of malaria. And the concern was that if you have malaria, the iron is feeding your body, but it's also feeding the parasite, right? And so the concern was that when malaria is endemic, are there risks of giving iron? So that was the question. So then the question was, well, who else gets iron? Pregnant women, right? And malaria during pregnancy can be quite serious as well. So what we wanted to do was to look at safety and efficacy of iron supplementation during pregnancy, also in Tanzania. And the issue is, if you have a pregnant woman, you know that she has iron deficiency or she has anemia, then you have to give iron. Like, iron is so important, right? But not every woman has iron deficiency or anemia. So if she comes to antenatal care and you test her and you find that she does not have anemia, she has good iron status, then how does this cost and benefit, like the benefit and the risk balance, right? If her iron is good, her anemia is, there's no problem, then if you give iron, is it giving risk if there's malaria? And is that risk greater than the benefit for iron, knowing that her iron status is also good? So that's what the study was trying to do. So that was the idea. Is there some harm that is outweighing the benefit if you're iron replete? So replete is the opposite of deficiency. So you have adequate iron and you're not anemic. So that's what we were trying to do. So look at safety and look at efficacy of providing iron during pregnancy in a place where we know we have malaria. And so this was a randomized, double-blind, placebo-controlled clinical trial with pregnant women who come for antenatal care. It was in Dar es Salaam, Tanzania. So Dar es Salaam is on the coast. It's a kind of a tropical environment as well, big city, and so on. And this study was, well, okay, before I go there. So there's a lot of words here. So what is, so randomized clinical trial, what does that mean?
We have the control group, experimental.
So two different groups, and then people come and they are randomly put into one or the other, right? So they don't choose. We decide who gets what, and I'll talk about what they're getting exactly. So the placebo, so we know we want to test iron. So clearly someone is getting iron. Then what is placebo? You know that word?
Placebo is the supplement that not contain the medicine.
Exactly. Yeah, it's sort of like, it's like a treatment, but it has no active ingredient. So those women will get a bottle of pills and they will take the pills, but the pill has no active ingredient. So there's no iron. It's just, filler. So, but the pills will look exactly the same. So when you get it, you don't know whether you're getting iron or you're getting basically nothing. And that is the double blind. So exactly what is double blind?
The double blind is maybe the research, the team, they don't know which group is taken the real pill. Which group that take which group that get the iron and which group get it.
Exactly, and it's double because the double is the participant and the researcher. So the researcher should know who will not know who gets iron, who gets nothing. Everybody gets, a bottle of pills once a month, but you don't know what is there, and the participant doesn't know. When you do the informed consent, you tell them you might get this, you might get that. If you get this, there's some risk. If you get that, there's some risk. You discuss everything, but you don't tell them exactly what they are getting. This is actually, some of you I know do RCT kind of work. It's actually quite a tricky idea, right? Because you have to give, during pregnancy, you have many months. You have to give the same thing, you can't give iron 1 month and next month you give, placebo and then you give iron. You have to give, once you get assigned to iron, you should get iron the whole time. But I'm not supposed to know who's getting what. So then who knows what's happening, right? So you actually have to have a lot of systems in place to make sure that people are getting the right thing and everybody is getting what they should get and there's no mistakes. So you have to have a pharmacy, like someone must know, who's getting what, right? And we can spend a whole hour talking about how to make that work. If you're interested, we can talk another time on that. So randomized, double-blind, placebo-controlled clinical trial, pregnant women, Dar es Salaam. And this trial is registered. Are you familiar with trial registry? Have you heard of this clinical trial registry idea?
ถ้าเกิดได้ยินบอก clinical trial
Yes.
Some of you, yeah. Can you explain what it is?
อธิบายให้รู้เรื่อง clinical trial
The clinical trial is a long-term research.
Yeah, but what is the registration? Register what, how, why?
registration เป็นยังเข้าใจว่า trial registration
Have you seen that?
I think that if you do for the clinical trial
Mhm.
need to register for the part of control the quality.
Yeah, it's a kind of accountability and quality control. So there are certain registries that are international. This is one of them. This one called clinicaltrials.gov is an American one that's very well recognized. There are several others that are well recognized. If you look on a WHO website, you'll see a list of trial registries that are available internationally and are recognized. There are other registries that are not that recognized, so you have to be a bit careful. Find one that has a good reputation. And so what this is that before any work is done, you register your trial. You say these are the objectives, these are the outcomes, this is the intervention, this is the control group, this is the type of analysis we're going to do, this is the research question. All of these things are stated in advance. And then you put this in a public place so anyone can see what you're doing, what is your objective, what is your sample size, all of that. And then it's a sort of accountability. So before you have any participant, you do this registry, then you start your work, you finish your work, you publish or do a presentation, whatever you do. And then people will go back and they will look at this and they will compare what you did and when you finished to what you said you were going to do in the beginning. And if there's any difference, they will ask questions. So it's a way of kind of holding to a good standard. Because what happens is, suppose you do your study and the result, you don't like the result, but then you check a different outcome. And maybe that result is nicer, or you do a different analysis and it's, you like that answer better. Like you work very hard for this kind of thing, right? And so you always want to find something that is good, that is significant. And to keep us from searching for good results, we make the statement in advance. This is the objective. These are the outcomes. I'm not going to go find another outcome that has a better result later. I can do a secondary analysis, but I must do this first analysis that I said I would in my registry. And if the result is not significant, okay. I mean, that's still good information. So now if you ever think of anything that's randomized trial, it doesn't have to be something like this with supplementation. It can be, like a community, maybe you have a social behavior change intervention, right? You work in communities or you work with health workers or something like that. Even that, now the standard is doing trial registry. So if you ever do any kind of randomized type study, consider doing this, because when you go to publish work, the better journals internationally will ask for this. And they will expect you to do it before you enroll the first participant. If you wait, then it's sort of like, I looked at my data, then I said, okay, well, preliminary looking at the data, maybe this outcome is best. So you're kind of biased when you do that. If you do it before you see any data and before you see any participant, then, it's kind of like that's the original plan. So keep that in mind if you do this kind of work. And then here's the citation too, if you want to find that as well. Okay, so there's a lot of things we can talk about the study, but I'll focus on a few things. One is something called inclusion and exclusion criteria. Do you guys know what that is?
คือได้ที่ว่ารวมเงินให้ที่ว่ารวมธนาคารครอบครัวแล้วก็บริษัทครอบครัวก็แม่ผู้ใด
So the input and output that we have to decide which one is our means for the research, or not concerning our research with exposed.
It's for the participant.
Yeah.
Is that right? Yeah. So if I'm working in a certain clinic and I want to enroll pregnant women and they're coming for antenatal care, then I have to decide, should they belong in my study or not? How do I select? So inclusion is the one you bring them into the study. Exclusion is the reason to keep them out of your study. So in order to be in this study, they had to be iron replete. So they had to have good iron status at the beginning of antenatal care. They had to be non-anemic, pregnant women who were not infected with HIV. And they had to be in their first or second pregnancy. And they had to be at or before 27 weeks of gestation when they started the study. So multiple reasons. Okay, so first of all, if they are iron deficient or if they have anemia, you know, the risks of not giving them iron are too great. Like they just need to go and get iron. So they didn't come to a study to give placebo or whatever. They just go directly get iron. They don't get involved in the study. We excluded people with HIV because with HIV, they also have extra needs, right? And there's more complicated relationships when you have HIV and you have malaria and you have pregnancy and you have iron deficiency, you know, there's a lot. We just omitted people who had HIV. The first or second pregnancy was because if you have malaria infection, there's something that happens, there's a change that happens in the body in later pregnancies that makes malaria like not as severe. The real concern was, especially if you're in your first or second pregnancy, there's greater risks from malaria infection than later pregnancies. So we focused only on those that were going to be the most vulnerable. And then this before 27 weeks of gestation, it's because in Tanzania, it's very common for women to wait to go to antenatal care. But if they come at 30 weeks or 32 weeks, then the time of supplementation is very short, right? So if you see no benefit of supplementation, well, maybe it's because they only had it for, 10 weeks or 8 weeks. So all of these terms, so those are the criteria that you have to have in order to participate in the study. And it's very important that all of those terms are defined in advance. So iron replete, like what biomarker do you use? And then what is the cutoff of the biomarker? Do you use ferritin? Do you use hepcidin? There's many options. So you have to define what they are. HIV, do you use a rapid test? Do you use an antigen test? Like which test do you use to confirm HIV? 27 weeks of gestation, do you use last menstrual period? Do you use ultrasound? Do you use fundal height? There's many options, right? So you have to decide exactly how that thing is going to be measured, define it, and that's what you will use. The reason why these things are important is that this is actually how you define the population, right? So we've been talking about population and sample. The population is what you want to make an inference towards. You want to make a statement about this whole population, but what is that population? It is going to be women who have good iron status, who are not anemic, who are pregnant, but not HIV, right? So you might do the study, you get a certain result. Does it apply to pregnant women with HIV? We don't know because we didn't include them. That's a whole other area of research, right? It may be applicable, it may not, right? We don't know. So we define the population. There are times in a study where you have to maybe you have to make a change for some reason. And if you make a change to those criteria, you will be changing the population to which you can make inference. So you really have to be very careful with any kind of changes. And I mentioned the trial registry. So when you do a trial registry, one of the things you register is exactly what your inclusion exclusion criteria are. If in the middle of the study you feel like, oh, I have to make a change, then you update the trial registry. So it'll say, August 31st, we change one criteria from here to here. and you might have some explanation why. So it's very well documented. Yeah. Okay. So yes, change the population to which you can make a generalization. And so what, there's a term, I think it's probably in module 6 about this generalizability. Do you remember this word from module 6 about talking about what you can infer to what kind of population?
Generalization.
No?
I think Roger slightly used the word last time, but not exactly. I think we'll get to it next week. Yeah, generalization just means from your sample, you want to make a statement about the population, right? That is external validity. So that is what that is. Now, those are your criteria, but I told you kind of where the study is happening and who it's happening with. So there are some unstated criteria when you talk about generalizing to a larger population. Is there anything else that you would think about in terms of, any unstated criteria that are not here, that are kind of automatically happening because of the context?
Repeat your question.
Like, so those are our inclusion and exclusion criteria, right? But there's actually other things, because the study is happening in Tanzania. It's happening in Dar es Salaam. There's some things about the environment that is there. So when you think about generalizing to a larger population, are there any things you should think about?
Culture.
What is country?
Culture.
Culture.
Or something that is maybe affect to your inclusion study and exclusion study that you influence in the population studies.
Right. Yeah. So I haven't talked to you yet what the outcomes are, but some of them are going to be perinatal outcomes, right? So there can be culture, there can be diet, right? Okay, there's malaria in Asia, in different countries of Asia, right? Would these results apply to an Asian country? Maybe, maybe not, right? Because I mean, obviously the biology is the same, but the environment is different. Maybe the types of infections during pregnancy, other infections during pregnancy might be different. Nutrient intakes can be different. So those are things you have to kind of think about. There's, so I didn't say like in this you have to be a Tanzanian woman or there's not like that, but all of these people who are coming are going to be Tanzanian. They're going to be a certain, they're coming for antenatal care. So maybe they're not very, very poor, but they're not wealthy, right? There's a certain degree of wealth. In another country, maybe people have more wealth, maybe they're more poor, maybe they're rural, right? This is a very urban setting. So is there something urban or rural going on? So you have to kind of think like, okay, will this apply to rural Tanzania? Will it apply to a neighboring country like Kenya? Will it apply to Laos? We have to think about that. So even though it's not explicitly stated, you have to think about who you can generalize. Will it apply to the US? I don't know. Although there's less malaria. Okay, so then here's the flow chart. So if you have the PDF, you can look at it in more detail. This kind of flow chart is a very standard way to show participation in a clinical trial. There are some kind of guidelines that are also international about how to report a clinical trial, and I can tell you more about that if you're interested. But usually what you do is you show the flow of participants. You find women who come to antenatal care. You apply your criteria, and if they don't meet the criteria, you just tell them, thank you, go over there for standard of care. If they do meet the criteria, they do informed consent, then you have your group. We had a 1,500 women. Then they got randomized. So they either got iron or placebo. So 750 in each. And then we follow them over time. So to see what the results are. And then things happen, right? So sometimes a woman will we lose contact. We try to reach her, her phone is not working, or she's not at the same address. We just lose them. And then sometimes we don't have a live birth, right? There's a fetal loss. Many things can happen, right? Sometimes a child dies. So many things can happen. The other thing is actually, so in this study, one of the primary outcome was not just malaria, but was placental malaria. So we would actually, when the woman delivers, we would take the placenta and do histopathology and look for parasite in the placenta. And then we would look at that kind of as a binary, present or absent. And then we actually did parasite counts as well. So we wanted to see if the iron was affecting the placental malaria in particular. So you can imagine this was a little bit of a crazy study, because a woman is coming to hospital with 50 other women who are delivering today, right? And then you have 50 placentas, maybe more if you have twins, right? You have to somehow find the right placenta to do pathology. So we definitely missed some placentas. And in Tanzania, sometimes women don't come as soon as they have some contraction. They might wait, because the hospital, it's very crowded. So sometimes they might go, they're trying to go to that hospital, but they come to this clinic because they realize they don't have time. Or on the way they deliver the baby, or maybe they go to their mother's house. Like, so many things can happen. So what happened was there were many cases out of 750, 200 something, we didn't have a placental sample. We had a coordination with hospitals and clinics, but you have to ask the staff, take one placenta and just kind of keep it until we come with our bucket and get your, so it was a little bit crazy. And we missed samples. Sometimes they delivered in a different hospital. Sometimes they were not at home when they delivered. Maybe they had gone back to their village. Some are just missing because we didn't come in time. Maybe they delivered in the night and we had a 24-hour kind of phone call, but it's very hard when a family is having a baby. They don't call. First thing is not to call the study, right? They'll call somebody else. So we missed a lot. And then, so in each things, we had about 500 out of the 750 in each arm that actually had a placental sample where we could do the pathology. So is this a problem? Or do you have some concern about that? It's missing a lot, more than we liked. We tried our best, but. You are concerned. Why?
It's a big concern because that you register that, but you lose more than 30%.
Mm-hmm.
It's affecting your result.
How does it affect the result?
Because that for the results, for example, like when you indicate for the malaria along the deficiency, for the total is 738 thing, but when you compare to the percent malaria percentile malaria, that cannot be the it's not simple like the representative because that you miss a lot of the sampling, right? The sample. It could be you can report the total of proof of the number of this one that you missed a lot. So the reliability is or validity that from your is not
Yeah, now you're using the right words. So one is there's a sample size issue, right? Every RCT has a power calculation. So the power calculation says, I need this kind of sample size. If you have less, you have less power. And maybe you don't have enough. So that's one concern, is the sample size is too small. The other one is validity, right? So the whole point, well, okay, the validity can happen in many kind of ways. One is, you remember the example from yesterday, right? Where we had a sample of 100 children for anthropometry and we missed 30. And we said, what if those are the ones who are most poor or the most stunted, right? Our estimates changed. So that can create bias. So what if you're trying to estimate what is the incidence of placental malaria, maybe in this group, but the ones who are missing are the ones that were more likely to have placental malaria. Like the ones that are truly missed like this, or they might be outside, the city is very big, right? So some people, they come for antenatal care very regularly, and they have a very stable situation. Others are people who are maybe, like, there's a lot of rural to urban migration, so people who may not have as permanent home, they go back and forth to the village. They may have to not have a stable living condition because they just recently came to the city. They might be in situations where there's more malaria, right? Like they might live in a neighborhood that has more malaria, more water, more mosquitoes, like less healthy living conditions, right? So if those people are the ones we miss, and they are more likely to also have malaria infection, that is going to affect our estimates. So that will create bias. And then the other question is validity, because the whole point, and this is there's two kinds of validity. Well, there's actually many kinds of validity, but two that we'll talk about a lot. One, we already talked about external validity. So whatever we're trying to make an inference about, we had that population in mind, right? If for some reason, like these ones that are just missed are living in more marginal housing, or they are more connected to the rural community than being an urban, if we're missing them, can we draw inference about those types of mothers? Right? Or is it only those women who come very regularly for antenatal care, who deliver in the hospital? Like maybe the answer can only be applicable to them, right? So that's affecting our external validity. There's another kind of validity that is internal validity. How reasonable is this comparison? Because we randomized people, we expect these two groups to be on average the same. Like you and me, like we're all very different. Individuals are different, but as a group, if we just randomly pick them, on average, the group should be the same. These should be about the same age on average as these women. They should have the same, roughly on average, income as those women, the same amount of education, because we just randomly allocated. If we let people choose, then you might find that these ones have more education than those ones or something. And then the comparison is not valid, right? But if we start missing people, if we miss people here for one reason, and we miss people here for a different reason, now we're comparing groups that are not the same anymore. So maybe you find that if this group, after all this missing, you find that there's more wealth, these people have more money or more income than these people, and you find that their health outcomes or their perinatal outcomes are different. Is it because of iron or is it because of income? You don't know. It could be either one, and you can't say for sure iron was the problem. Maybe it was income. So anytime you have loss to follow up, like you have to kind of see, is it affecting my estimates? Is it creating bias? Does it affect external validity, who I can make a generalization to? And is it affecting the internal validity, that the reasonableness to make such a comparison? Okay, so I wrote that down actually, all those considerations. This is kind of a standard definition. So because the whole point of an RCT, the whole point of randomization is you want to really talk about cause and effect. I give you iron, this is affecting your pregnancy outcome. you want to say the iron is the reason. Everything else is kind of shared between the two groups. The only real difference between the two groups is who is getting iron, who is not getting iron. And so if I find a difference between the two groups, then I say it's the iron. Everything else was shared. The iron is the difference, and the iron is the cause of an outcome. And internal validity is when you can no longer say it, we know it's definitely iron. In that example where this group, because of these missing, if this group has more money, then you can say, well, the cause might be iron or the cause might be income. But I can't tell you how much. Maybe it's 50% and 50%, and maybe it's 10 and 90%. Who knows? You know, you can't separate them. Does that make sense? So the point is just to be kind of skeptical. Like when you read this paper, okay, it's published, but you should still ask some questions and expect a good answer. Yeah. Okay. Here's the characteristics of the people. And again, it looks very small. So if you have the PDF, you can take a look. This is just baseline characteristics. It's very typical. And we compare the iron group and the placebo group. And in general, there's no statistical testing here because we randomize. These two groups, they're not going to be exactly the same, but they should be very close. The profile should be very similar. Otherwise, something went wrong in the randomization, right? So as long as you did the randomization process very well, that's okay. One thing that surprised us was this part here. This is about a malaria prevention method. So we asked them, do you use a bed net? When you sleep, do you use any kind of insect spray? So anything, what do you do at home to control malaria or to control mosquitoes? And we found that there were very high rates, right? Like they actually, there was a lot of change that happened during the time of the study. There was a lot more treatment. You know, these combination drugs became very widely, the types of drugs became more effective. They were more widely available. People were taking, there was a lot of awareness about using bed nets. And so there was good malaria control, which was surprising. In the time of the study, things changed a lot. Malaria in Dar es Salaam actually went down a lot, which was good for everybody except for the study because there was less malaria. But then this made us really think about external validity also, because we wanted to work in a place where malaria is endemic, but it's still endemic, but there's good control. So if we worked in a different place where malaria is endemic, but we didn't have such good control at a household level, is the result still applicable? Maybe, maybe not, right? So we said like, okay, we're answering an important question here, but can we really say something about all places with malaria? Maybe not. Maybe it's only in the context of good control. So we had to think about that. Now, I'm going to show you very quickly just the big picture of the results, and then I'm going to talk about like some specific results, and we can talk about hypothesis testing. So there are basically 3 tables of results. They all kind of have the same format, and they are organized by the type of outcomes. So we had one table that was about maternal outcomes. So there we had the placental malaria, kind of maternal like hospitalization. There was some morbid and some mortality, other kinds of adverse effects. So that was the maternal outcome. Then we had a table of hematological outcomes and iron outcomes. So we had hemoglobin, anemia, ferritin, and then the biomarkers. We did ferritin. We also looked at inflammation, so CRP, AGP, and so on. Actually, I think we just did CRP. So that's hematological outcomes, and then we had the perinatal outcomes. So low birth weight, preterm birth, mortality, fetal loss. We did small for gestational age also using different metrics. So all of them are just organized by type of outcomes. So let me go back to table 3 and just go in more detail. When you make tables like this, and I know some of you are actively doing research and you're trying to publish some papers, what's always helpful is to have your tables be kind of freestanding, right? Like you guys have not, most of you probably did not read the paper, right? But if I take this and put it in a PowerPoint, this table explains a lot, right? It has all of these footnotes. It says like, okay, severe anemia, I defined it as 8.5 grams per deciliter, like, you know, for the small for gestational, oh, this is not here, but in the other table, small for gestational age was measured using this standard. You don't need to go back to the methods and read everything. You can just see all the information here to understand the table. So when you make tables, like use things like footnotes, like give all the details. So when people just look at the table, because many people, when they read papers, and I do this, probably you do this, sometimes we just read the tables or we just read the abstract. We don't read the whole thing. Sometimes if you really want to read one paper, you might read everything, right? Because it's very relevant. But then many other papers, you just kind of look quickly, right? So sometimes people will just look at the results. And so you want to give them as much information as possible, knowing that they may not read so carefully. So that's one thing. So then, okay, so here, let's just look at some of these kind of anemia and iron outcomes. So you have your outcome, you have the results for the iron group and the placebo group, and then you have some statistics. So in the iron group, you have kind of what are some values and what is the sample size. So if you remember, like certain outcomes had a better sample size. So for the perinatal outcomes, we knew most of them. We knew what happened. Was the pregnancy, was it a live birth? Was it a fetal loss, a stillbirth? Like we knew those kind of things. But then for the placental malaria and some of those other things, we didn't have as big of a sample size. So you can see the sample size changes a lot. And it's not exactly the same between the two arms. It's usually comparable, but, you know, slightly different. And then here's our findings. So let's look at just this. So this is hemoglobin at delivery, grams per deciliter. So in the iron group, the average, this is average, and in parentheses is standard deviation, sample size, average, standard deviation, sample size. And then there's a p-value. So on average in the iron group at delivery, it was 11.8 compared to placebo who got no iron, 10.9, right? And then we do a statistical test, like a t-test. Actually here, okay, so in the paper itself, we actually did a non-parametric test, but since we can't study, you know, every statistical test in 2 weeks, let's just say it's like a t-test, but it's a non-parametric version. So this is just a simple t-test, right? And then you have a p-value. So going back to what Professor Roger did yesterday, every statistical test has a null hypothesis. So what's the null hypothesis? So you have a p-value, so you know I'm doing something. What's the null hypothesis here?
What's the question again? Sorry.
This is a statistical test.
Okay.
What's the null hypothesis for that statistical test?
Let's see. It's significant for sure. Oh, it's fine. The number is this is hemoglobin.
Uh-huh.
Delivery. For the placebo.
Hang on. Mean HB. Uh-huh.
Okay. And how is it right with the delivery?
At delivery, yeah, good. Uh-huh.
Using KBS at 2 seconds.
No, we don't want numbers yet, because the null hypothesis is just what is the truth. That is, those numbers are for your sample. Null hypothesis is always about the population. There is a mean hemoglobin for delivery.
Okay. The mean in
For iron group, yeah. So let me see. Let's say it's with iron supplementation. With iron, I'm going to just use shorthand. Supplement is going to be.
So the number, this is the mean. What is it? Fine, but the hemoglobin in the iron group is not different from the hemoglobin in the principal group.
So what does not different mean? You can just say equal, right?
It is equal.
Yeah. Mean HB at delivery without, oops, sorry, my rating is terrible, without iron supplement. That's your null hypothesis. You're saying that the iron supplement, so, and remember, and I notice I'm being careful. I don't say in my sample. I didn't say in this group versus that group, because the null hypothesis is not about this group and that group. It's about all women, right? All women who are getting an iron supplement, the null hypothesis is that their hemoglobin at delivery is going to be the same if they don't get the iron. Now, of course, we don't believe that, right? Like the null hypothesis is the thing that is sort of like nothing is happening. The whatever the intervention is, the intervention here is iron supplement. Like it has no effect on your outcome, right? What we really want is the alternative. Let's call it HA for alternative. And it's this thing is not equal to that thing. And this is what we truly believe. Like I would expect hemoglobin, my hypothesis would be that hemoglobin will be much higher at delivery if I get iron during pregnancy, right? I think we would all kind of believe that would be higher. By how much we don't know, but we're just saying that it's not going to be the same. Okay, so that's my null and alternative hypothesis. And then I get this p-value, which is less than 0.001. So it's a very small number.
But it should be showing the confidence interval or the low, upper, low bound, the other.
Oh, we're not doing confidence interval yet. That's the next example. So right now I'm not doing confidence interval. I'm doing the statistical test. I have this. So my null hypothesis is that these two means are equal. In the sample, I have 11.8 compared to 10.9. And there's a lot of variability, right? So this is standard deviation. That's 2 grams per deciliter, roughly standard deviation, which is a lot. It's a lot. But so what is my conclusion? Do I reject or I don't reject this?
You reject it now.
You reject because?
It's statistically significant and that.
Why is it significant? Like what tells you whether it's significant or not?
Yeah.
Which is?
Just more true to the area of projection.
Right. It is, the p-value is small, right? Usually okay, so you have to decide, and again, this is part of your analysis plan before you ever look at data. You decide what your significance level is going to be. And most people, we tend to use 0.05. So when the p-value is small, what you're saying is this difference of 11.8, which is much higher in the iron group than 10.9. We're saying that this difference, that the possibility that iron makes no difference, and this is just pure chance, just luck that this number is bigger than that number. That chance of just being luck that way is very, very small. So it's probably not luck. It's probably that truly iron is increasing hemoglobin at delivery. Right? So we reject. So we're going to reject this guy. Reject. And we conclude that here, actually, this iron group, iron during pregnancy is going to be increasing hemoglobin at delivery, which that one we probably knew. But then we do this for every outcome. So this was a continuous outcome, right? We had numbers, and we're looking at the exact mean and how one mean is different from the other mean. Now, there are other outcomes here who are not continuous. So for example, anemia, right? And here, if you look at the footnote, you can look at any level of anemia. This is looking at just any kind of anemia. So any hemoglobin below 11. So anemia at delivery. Now we've taken this HB number and we make it binary, right? We're making it nominal. So either you have anemia because you are below 11 or you don't have anemia. So now we are calculating something else. So what this is here is that this is the number of women. So 144 women in the iron group had anemia at delivery out of 481. So that is 29.9%. So among your iron group, you had 29, let's say 30% anemia at delivery. And then in this placebo group, you had almost 50% anemia at delivery. So definitely it looks like anemia is much higher in the placebo group, which is also our hypothesis, right? You expect, if you're not getting iron, you expect more anemia. Yeah, makes sense?
Yep.
It's okay? But then the question is 30% and 50%, is that very different? And you conclude, yes. So let me say, so this kind of, when you have a binary thing, you can kind of say it in a few different ways. You can say the probability of anemia at delivery with the iron supplement is the same as, I'm going to write short, probability of anemia at delivery with no supplement. That's your null hypothesis. Yeah? Are you okay with this? And so then HA is just going to be the same, but it's going to be not equal to. And in truth, the hypothesis, before you look at the data, you would imagine your hypothesis is that this probability will be higher, right? Like if you don't get iron, you expect your chance of getting anemia to be much higher. So that would be kind of your so you have your null hypothesis, your alternative hypothesis, and then your hypothesis of what you think is really going to happen. And all of these things you really should lay out before you look at any data. So this is what that test is. The p-value is also very small. So we reject this and we say actually the probability of anemia delivery depends on whether or not you get iron. And it's affected strongly actually by whether you get iron. But here I have something new here. I have a relative risk. And I think Roger did some example with the relative risk, and we talked about it yesterday, but can you remind me what is relative risk?
Co-risk that support.
It's what?
The co factor that support for.
Not quite. Not quite. Oh, so not the co-risk factor exactly. You had, so it's looking at, so there's a certain risk. So if you think about risk is just the probability, right? Probability of me having anemia. So if I were getting iron, my chance of getting anemia is 30%, right? Is 29.9%. If I were not getting iron, it would be 49.5%, right? I'm just going to call it, so here. So in my sample, now this is your sample, my actual data, with the iron supplement, let me just round to 30%, right? This one was 50%. The relative risk is just the ratio of these two. Let me go. What is it? 29 what? 299 and 49. Yeah. Okay. 0. Did I write the numbers right? Which is 0.6. I just take the ratio, the probability of this, so this was 29.9%. This was really 49. I'm just doing some rounding. This is the ratio of the two risks. So it's the risk of this relative to if I don't get supplementation. So my relative risk is going down if I get iron. I'm looking at my risk of anemia and it's going down. It is 60%. If I get iron, my risk is 60% the risk if I didn't get iron. Does that make sense?
That means if the women who are not get the iron will be at least 60% of anemia.
No, if I don't get iron, it's about 50%. I have a 50% chance of getting anemia, right? If I get iron, I have about a 30% chance of getting anemia. So it's reduced by 40%, right? So that's what the 0.6 is. It's 60%. This is 60% of that, right? So the smaller this gets, the better it is, right? The better that iron is protecting me from getting anemia. So if this one had no effect, if these two probabilities are the same, what is the relative risk? Not very. Is the blue better? I don't know where to write this. So if HO is true, then the relative risk is going to be what?
Zero.
I see what you're doing. You're close. So if HO is true, then this probability is equal to this probability, right? So if I take the ratio of the two, it's 1. It's the same probability, right? It would mean that I have a 50% chance here and a 50% chance here. So the ratio of the two, the risk ratio is just 1. So another way of writing this null hypothesis in this kind of case, when you have this nominal, this binary category, is to talk about it in terms of relative risk and say relative risk is 1. Probability is the same in either condition, iron or not iron. And then anytime you go away from 1, then something is happening. So here I went pretty far from 1. There's a 40% reduction in my risk. And according to that, it's statistically significant. 40% reduction of the risk of anemia is kind of a lot, right? Like that's pretty important. If it were 0.9, yeah, okay, so a little bit of reduction, but it's not that great, right? What if it's 1.5? If this were 1.5, what would be worse? Getting iron or not getting iron?
Should not.
You should not. Yeah, so it's worse if you get iron. So if this were 1.5 times that, then iron would be bad. So right now what we're saying is iron is protective for anemia. If it is greater than 1, then it's actually harmful for anemia. It's increasing the risk of anemia. And if it was equal to 1, then iron has no effect. Okay, you will see a risk a lot in all of these. Now, we know that from this test, it was 0.6. So here's the relative risk, 0.6. And then there's this confidence interval, and it's a 95% confidence interval. So basically what this is saying is that, okay, my estimate is 60% of risk. So a 40% reduction of risk if I get anemia, if I get iron during pregnancy. But we have some uncertainty, right? Because, there's a lot of uncertainty. So it can be anywhere from, 0.51 would be a 49% reduction. 0.71 would be a 29% reduction. Is it making sense? So we're saying this 0.6 can be anywhere from 0.51 to 7.1. So, but regardless, that is a lot. And notice how that interval doesn't contain 1. This null hypothesis number, if that is inside that interval, then your p-value will be not significant. A confidence interval has a direct relationship to the statistical test. If this null hypothesis number is in the interval, then your p-value will be big. You have a 95% confidence interval corresponds to a 5% significance level. It's exactly, the mathematics is exactly the same. So you have you actually have a choice. You can have a choice of presenting this confidence interval, and then everybody should look at this and say, look, that's less than 1. It's reducing the risk of anemia. Or you can produce the p-value and say the p-value is very small, must be reducing the risk of anemia. But the conclusion is the same. So I can delete one of these and present the other because they are doing the same work. Is that okay? Questions? Okay, well, let me see. How's it? Yeah.
Just back to the mean. The mean hemoglobin level with the Arab group and the placebo group, and show that even very small difference.
Which one is this?
It's 11.8 and 10.9.
Mm-hmm.
Okay, even very small difference, like 0.9.
Yeah, 0.9.
0.9 gram per minute.
Mm-hmm.
Even small difference, it is significant in statistical. But is there any possibility for big difference but not significant? Have you ever seen that before?
Oh, yes.
How could we explain that?
When you have a lot of variability, right? So imagine if I'm going to not follow Roger's advice and make a terrible graph. But let's okay, well, he can blame me. But like, suppose you have this. Let's use black. And then say this is iron and this is placebo and this is HB at delivery, right? And iron, the mean was like this, and then the placebo, the mean is like that. And you're like, okay, look, that looks very different, right? But this is the mean. You don't know what the data look like. So if I put the data, maybe it looks like this and like that. It still looks different, right? Okay, but so it's the same difference on average, and it looks clearly different. What if your data are like this versus now it's the same mean, but now you're not convinced, right? Because now you have so much variability, right? Like this is the placebo, and if this is one woman, this one woman is doing better than all of these women in the intervention group, right? So maybe, so the more variability you have, the less you can really tell, is that truly different or not? If they're very clearly separated, sure, fine. It must be significant. But if the more noise, and certain outcomes are going to be extremely noisy, right? If this were like nutrient intake, right? If this were like some kind of, I don't know, milligram of calcium or something dietary. Like Carmen was talking about dietary intake. That is so noisy. Like, even though there's some effect like this is going to be totally spread, right? Everybody eats differently. There's measurement error. There's day-to-day variation. There's, 500 ways. for people to have different intake and your measurement of a nutrient. So most nutrient intake data are extremely noisy. Other things are very precise, right? So if you measure like a biomarker, not every biomarker, but some biomarkers, that things are much more controlled, right? Even if you measure HB compared to like if you measure blood pressure can vary. You know, are they stressed? Are they what? You know, like all of that. Yeah. More questions.
Another question. Since that it is small or large difference of meat, but you want to make sure how precise it is. What how or what numbers can be shown here for the more precise of the difference?
Oh, I mean,
For categorical data, we have confidence interval like that for the oats, but for the meat, do we have a kind of upper or lower bound to be showing there?
you can. Usually what people are interested in, this sort of thing, is the effect of the intervention. So yeah, you can make a confidence interval for these means. So, but you don't really need to, because like here, like this is a mean, that's the standard deviation. So if you make the confidence interval, and this is the sample size, your confidence interval will be some maths that you do with these three numbers, right? So it's kind of the same. Do you want to present it as like mean, standard deviation, and sample size, or do you want to just give the CI? Sometimes this is nice because sometimes people will do further analysis. Sometimes people do meta-analysis or some kind of thing. So people like to see the sample size, like these things separated. But yes, you can take these three numbers and calculate a confidence interval for the mean, and that would be valid. That would be fine.
Yeah, because I think if we see the difference of the meat, at least we know what is the lowest value of difference and what is the highest value of difference.
No, that will be different. A confidence interval for a mean and the actual range of the data are going to be two very different things. Because the data can range this much, right? But the mean is a specific number, and the uncertainty of the mean is going to be much smaller, much more precise. And the more sample size you have, the smaller that confidence interval is. The true data has natural variability. Like even if you have 1 million patients, it will still be this variable. But the mean with 1 million patients will get, like, the CI will get smaller and smaller.
We already have another example of that, but later.
Okay. Yeah, we can go on. So let me just finish this, and then I'll check in with Roger and Carmen. So there's many results there, and you can look at all the results and look at it. But in general, what we found here, I can just say very quickly, all of these things that look at adverse outcomes for the mother, these are basically, they're not significant, right? All the p-values are pretty big. Iron does not seem to have an effect on placental malaria. It didn't increase the risk, but the hematological outcomes are much better. So iron doesn't seem to have very much risk, but it does seem to have something very positive in terms of hematology, iron status. For the most part, we did not see a difference in perinatal outcomes either. So when you look at like fetal loss, low birth weight, preterm birth, small for gestational age, things were not significant. We were hoping, but they were not significant. And so basically what we find in this population, and you do want to make this kind of a very clear statement. It's not all women, right? Because we don't have anemic women. We don't have HIV women. So in the population, right, prenatal iron supplementation was not associated with an increased risk of placental malaria or any other adverse events. And remember, we noticed that this population seemed to have very good malaria control, and we thought that was important. So we actually limited our conclusion to say, in the context of good malaria control, we don't see any adverse effects. But we did see that women who got supplementation had improved hematological and iron status compared to those who did not. And so that suggests that we don't really see harm, we see benefits, and we should continue doing administration of iron during pregnancy, even in malarial endemic areas, as long as there is good malaria control. So that was the conclusion of the paper.
That's it.
Yeah. Okay. So I have one more example, but we spent, I talked too much. So I don't know, shall I hand it over to you guys, and I can save the second example had power discussion. Or do you want me to continue? Are you sure? Okay. Okay, let's, what's that?
I said we're already on the topic, so.
Okay. So this is again something you saw yesterday, and I just want to spend a little bit more time on this table. So we talked about type 1 and type 2 error. And then we talked about a lot of other things, sensitivity and specificity and all of these things. All of this from 1 2x2 table. There are really very many ways to look at this, and sometimes it gets a little bit confusing. So the whole point of this is that we never know what is reality, right? You don't know if you don't know what the truth is. Does an intervention work or not work, right? Those are going to always be unknown. But we can do some experimentation, gather some data, and make some conclusion that may or may not be correct. So suppose you have some kind of intervention or treatment or something, and then in reality, there's only two possibilities, that the treatments have the same result or they have different result, right? And that corresponds to your null and your alternative hypothesis. Now, the decision you make is here, right? We can either conclude that the treatments are not different or they are different. And that corresponds to that decision of reject or do not reject. Okay, so if the null hypothesis is true and you don't reject it, okay, that's good, right? And if the alternative hypothesis is true and you reject the null, everything is also good, right? That's the correct thing to do. The problem is these two, right? When the alternative is true, but you stay with your null hypothesis, that's one kind of mistake. And then, suppose the null hypothesis is true, but you reject, then that's the other kind of mistake, right? So what we want to do is minimize our mistakes, right? We will never know the truth. We will never know reality. We can only make this decision about reality, and we hope that we do the correct thing. So we want to reduce this kind of mistake, which we call a type 1 error, or this kind of mistake, which we call a type 2 error. And it's important to reduce both, right? But there's some trade-offs, which is what Roger kind of talked about. So now this type 1 error, when the intervention is doing nothing, but you reject you reject your null hypothesis. So you think something is happening, but it's not actually happening. You think the intervention is good, but it's useless. That is this kind of mistake. And there's a certain chance of that mistake. And we decide how much chance we want to allow. Like we make a decision that we're going to make this probability, the chance of this mistake be 0.05. This is completely arbitrary. You might say like, I don't like that. This mistake is very bad. I want it to be 0.01, meaning only 1 out of 100 times am I going to make this mistake, right? Or you might say like, okay, this is not a big deal. Let's not be so harsh. Let's make it 0.10. It's your choice. This is just a habit that people have to do 0.05. So you can debate that, and people debate this all the time. This beta, the other mistake, the power is the opposite of this mistake. So if your beta is like 0.05, then your power is 0.95. Okay, it's 1 minus beta. And power is the probability of finding something that is truly there. So truly this intervention has an effect, and you discover that it has an effect. That's your power, and you want more of that, right? You want to have less of this mistake beta. Now, usually if you read literature and so on, power is also something you decide, right? So usually people at the very minimum, they want power to be at least 80% or 0.8. Sometimes they will go higher and they'll say 0.9 or 90%. But at minimum, I think again, this is the kind of the tradition, people go with 0.8, which means that the beta is less than 0.2. So here's a weird thing, right? We control the type 1 error at 0.05. And for the type 2 error, we're saying 0.2, which is much bigger, right? It's 1 out of 5 times. 1 out of 5 times you're allowing this kind of mistake. It's a lot, right? Like, so why do we give more effort to the type 1 error than the type 2 error? Why? So we're really giving a more priority. We're trying to minimize this much more than we're trying to minimize that. So why in general are we giving more priority to type 1 error? Again, a type 1 error is like the intervention or treatment has no effect, but you think it does. Why is that bad?
Why do we focus on type 1 error? Type 1 error is we reject the true hypothesis.
So suppose I did this intervention. I think some of you, I give one of those webinars that we organize, and it was about a social behavior change intervention. We went with community health workers trying to improve child outcomes, also in Tanzania. And I find some significant result. But maybe it's a false positive. I think my intervention is working. I'm really excited. I do a webinar, you know, I tell everybody, but maybe truly the intervention is really not working. But I think it's working. What's the first thing I probably do after the webinar?
Or maybe try to use the negative or more negative question.
Well, it would be a false positive, right? Like I'm positive this is working, but that's false. So I do one of the first things, you run to the minister and you're like, hey, this thing is really working. Like, can you give me $20 million? I'll put it in the whole country.
It's the wrong way.
Yeah, exactly. Right. So it has a real consequence. Like, yeah, it's nice. I can write a nice paper, but the next step is like, okay, intervention's working. Scale it up, right? Send it everywhere. Use a lot of money that you could for something that is not working. And that same money you could have done something else, right? Money is always limiting. So, you know, we always have to be very careful with it. So if you go and spend something when it's not going to work, you lose not only like that wasted effort, but something you could have done instead that might work, right? So you lose that chance. So that's why we usually, you know, so maybe it's this other mistake. Maybe I say this intervention's not working, but actually it's working. But maybe people will do more work. They'll try to improve the intervention. We'll figure it out. We might get late, but we'll figure it out. But that's better than just going and scaling up, developing a national program on something that is not working, right? So that's one good reason. I mean, there can be other reasons as well. But how about the reverse, where we kind of let ourselves allow ourselves type 1 errors? Can you think of a situation? Actually, Roger mentioned a situation last time. Yeah. So now the previous case, we were like, let's control this type 1 error. It's not good. But what are some situations where we might allow this to happen? And try to control in the other direction. Try to control the type 2.
I'm not so sure if I remember what you had last time, but I guess theoretically.
It's what?
Something that is relevant to your theory.
No, no, we're being very practical now.
Something that needs to be up to the policy implementation plan. No, sorry, my bad.
Do you guys remember?
Remember the price.
It doesn't even have to be my example. You can think about cases where type 1 error is not really legalized.
There is no rejection and then no rejection when is rejection.
Right. Yeah. That is the kind of thing we do where we reject, but actually there's nothing to find. Yeah. But-
Modified genetics factors or we all know that some factors can be modified, some factors cannot be modified or leave. So,
I'm thinking even more okay, let me tell you. About a screening test. So for example, like the example we just did, women come for antenatal care, right? And you screen them for HIV, right? You want to make sure if a woman has HIV and she is pregnant, like you need to know that, right? You don't want to miss that because as soon as you do that, she gets counseling, she gets treatment, she gets PMT, CT. So it's very important. So remember this, like this was I took this slide from yesterday, this kind of, trade-offs and definitions, this line right here, right? Of alpha and beta. These are the two things we want to minimize. But this thing is like a sliding thing, right? I can take this line and move it back and forth. When I make beta big, alpha gets small. When I make alpha, if I move it this way, alpha gets big, beta gets small. There's a trade-off there. Okay? So if I really want to control, if there's a situation where the type 2 error is bad, then one thing I can do is have a higher alpha.
okay, I think of something like a kind of endemic disease.
Yes, so that is also a screening test, right? So type 2 error. So another way of thinking of type 2 error is when you miss something that is truly there, right? And there are times where you don't want to miss something that is truly, truly there. So what if this something is HIV in a pregnant woman? You don't want to miss that. So what do? You can do, you can allow yourself some more false positives in order to make sure that you reduce that false negative, right? So often, and I don't know how you do it in Laos, but in Tanzania, a rapid test has a lot of benefits, right? It's cheaper. We're always struggling with budget. So it's less expensive. It is fast. It is easy. The women are, you don't have to wait for a result. Sometimes the woman comes to a clinic and you take a blood and you go for an ELISA and you get the result in 2 or 3 days and the woman is gone. You can't find her again, and you can't give the result. So sometimes the rapid test, right away. But usually those types of tests have a high false positive rate. Right? So what happens? You give the rapid test. If she's negative, okay. If she's positive and there's false positives, then you might take some blood, send it to the lab, and confirm, does she truly have HIV? Right? That when you go to that, it takes more time. The patient has to wait. Usually that's more expensive. You need the laboratory, you need the ELISA machine, you need the reagent. You need, there's more to it, right? So you confirm the HIV infection, then if you confirm it, you come back and you do PMT-CT and everything else that you're supposed to do, right? So the first test of the rapid test, you allow yourself more false positives. You make you have a big group of women. You find the positives, confirm that they are true positives, and then you go from there. So that antigen test is done on not everybody, just a subset, right? And this is true whether if it's COVID test, malaria test, whatever. Usually there's some false positive there, and that's probably better because you don't want to miss these things. But it's a risk because, hopefully, usually if you have a rapid test and then you go for this confirmatory test, you don't tell the woman, right? You're gonna give her a heart attack now she's pregnant and now you tell her she has HIV, but maybe it's a false positive. So you wait, you do the confirmation. That there's that risk, but you keep moving, and then if you confirm, then you can give her the proper counseling. Yeah? Make sense? Okay. So all those things Roger told you are very, very important and real. So, okay. That's it. That's all I have. How are we doing? Yeah.
just to make sure that everybody understand.
Yeah.
ตรงที่นั่นเราก็เราตัวเองไปมีท่าเองมีโปะมีนั่นอันน่ะเป็นเรื่องหลายเองก็คือตึงมาชั้นย้อนว่าย้อนว่าบางครั้งขั้นปวดอ่ะนะขั้นปวดว่าเป็นเนาะปวดมาเป็นหรือปวดติดเสื้อแต่ที่มันผู้เป็นกระตาหรือว่าเรื่องว่าขนาดพอโพสิทีฟเนาะถึงมันสิบ่เป็นแต่มันแต่ความจริงอาจจะบ่แม่นก็ตามแต่ยังไงก็ใครกว่าสิปล่อยก็เป็นเลยอันนั้นมันก็พอจะสู่กระบวนการปวดมันเกิดเป็นเครียดอะไรเงี้ยนะเพราะถ้าเขาสิจำกัดตัวพอโพสิทีฟหรือว่าเทมเพอร์น้อยเกินไปมันจะอาจจะเรียกว่ามันที่ไทยพวกกันตัวเรื่องของเบต้ามันหลายขึ้นมันก็จะไปเพิ่มโอกาสให้พวกที่ว่าเป็นแล้วปวดข้ออันนั้นอันตรายอันนี้ปวดข้อถึงพวกเป็นอย่างแต่ปวดสาระคืองานมันเพิ่มเรื่องมันต้องเป็นอะไรที่จะเกิดขึ้นนี่คือแต่ในไทยควรจะปล่อยให้ตัวที่ว่าเป็นแล้วข้อมีมากเนาะตัวการตัวคนที่หลายขึ้นตัวเป็นแล้วข้อที่หน่อยลงเนาะถึงมาตัวพวกเป็นแล้วข้อมันถึงมันเกิดเป็นต่างๆให้ต้องยอมรับนี่ครับที่หมายของคือ
All right. We need a stretch. Yeah. Oh no. Explain this. He made the names. Yeah.
Okay, so we'll now start talking about how to formulate your own research questions and how to define research questions, and then from there, developing some aids and also developing your own hypotheses once you found the research you want to work on. So far, we've talked about nutritional epidemiology and just some background on the basics of nutritional epidemiology, what to do when we talked about different kinds of data issues that can come up related to the statistics. We've been talking about how to analyze data. Talked about the central limit theorem and so on. So now we're going to move in another direction where we're now talking about you've learned about how to do a test, how to do a hypothesis testing and so on. But how do you define your own hypothesis? How do you find something of interest to study as a researcher? So that's very important for anyone who wants to do research. So that's what we'll talk about. I think there's a break at 10:45. We will not be able to get through all of this in 15 minutes. So we'll do what we can and then continue after the break. So let's talk about research. So first question for all of you, how many of you are here because you're interested in research? How many of you have an interest in doing your own research?
Yeah, of course.
Of course.
So, okay, so why do you want to do research? Why, so those of you who raised your hands, why is it important for you to do research? What do you hope to gain by doing research? Why do you want to do research?
Findings, their program and result.
Yeah, so that's very general, but I'm talking about you. Not why do you want to do research?
We.
So the question, so just to circle back, so the question is, for those of you who raised your hand saying you want to do research, so on the more specific to you, why would you like to do research? Why is it important for you to do research?
For the personal, we need to improve the skill for the personal. But in general, we have to doing more some finding the evidence to showing or to show the decision maker to decide some how to decision that to solve this problem on.
Okay, so you want to gather information to be able to show, maybe, I think you used the word policy. If you didn't, I apologize, but I think I heard that. Policymakers, whether or not something that you think is of interest is actually the case or not. So that's one reason. Anybody else want to share why they're interested in research? Would you?
For me, because I'm working at the university, I'm also the lecturer, and the research is one thing that I need to improve our skill and also the capacity of myself. And also the benefit of the research is not only they can if we want to do something that we can translate our evidence to the policy or to solve with problem in our countries. And also the research is one thing that for me is we need to the publication our work to the international.
Okay, so what I'm hearing you say is that you would like to do research first to improve your skills, or learn more about research to improve your own skills in research methods, and then also you would like to make an impact. You like to make an impact with your research. You want to do research that is meaningful to you, and then also what was the last thing? The third one. And then share your results. Share so that there's no reason why you keep the results to yourself after doing research, right?
Can I?
Yes.
It is fun.
It's fun? Why is it fun?
It is so very challenging to me that we need to know it more and something new about it. And okay, firstly, it's fun. Secondly, it comes with new knowledge. Thirdly, it's worth for sharing. And I'm not sure about the sharing to the policymakers and how they will use it, but it's worth using it for change.
Okay.
It's something change from our hands. Our hands, from our hands. I think that we change from our hands for better conditions of health or whatever. It is very interesting.
Okay. Sounds good. So that's what we're going to talk about. We'll talk a bit about why do we do research, And why, and also think about how do you start questioning things that, and coming up with questions and having answers to address the questions that you're interested in.
And maybe for income as well.
And
You also said that she's teaching.
yeah, so she's teaching. I didn't include that on purpose, but then I just wanted to focus on the research. Yeah, because she's lecturer and she needs to teach and yeah, I didn't want to go there and publish. I didn't want to talk about publishing papers.
And maybe someone doing research for business or some investment.
Okay, so different reasons, yes, go ahead.
And also it's for the student also for the master degree in Lao PDR in various research to the research or disease ourselves, something like that. And also important to know the evidence of the exploration, the problem of the research. Beside you can just say about the evidence to make policy in the future. That's very important.
Absolutely. So there are different reasons for wanting to do research here. And so mostly, so I'm going to focus on we're going to be talking about wanting to do research to improve your skills for students. It's fun, and also to try to come up with a question and to find ways of sharing that. So the question here is, why do we do research? Of course, it seems obvious that, well, or are you interested in doing research? And it seems like a redundant question. Why would we ask that? But I think it's an important an obvious question to ask regularly why we're doing research, because it actually helps you improve your skills. So we need to do research to be able to get information or evidence on models and theory, and also helps us to develop and support knowledge that's currently available, and to also advance knowledge in our fields. And also for those of us who might try to share the information with others, it can also be able to help others make evidence-based decisions based on the results that we find. And then also potentially in nutrition, address nutritional requirements for the population of interest. So how do we start? So if you want to start a research question and it's something that you haven't done before, you have to start somewhere. And so how do you start with finding something that could be of interest to you? So, and something, especially if it's something new where you need to come up with something that no one has done before, how do you start? So one of the first place to start is you might have an idea of something you want to study, but maybe somebody else has already done it. It's not something new. And the way you first know choose a topic and then decide whether or not it's something that's been done or hasn't been done before, you do a literature review. Right? You start out, you read papers and see what's there, what's been published on the topic that you're interested in. And then from reading, you start thinking about what can you add to the knowledge that's currently available. And if there's something that you see that you're not quite sure of that you support, then that's also giving you some ideas about what you can potentially study. So what we do is start by doing a thorough literature reviews to see what's currently available on the topic you're interested in. And then from there, you're able to identify a missing link, something that you could add, or something that's of interest to you based on what you've studied. So based on your own literature review. So that's where we say we define a research gap. What can you add? After reading what's already available on the topic, what is something that you can add that's new to the field? So then when you do that, that helps you come up with a research question. And then from there, we now become more specific and then think about some specific aims. And then what's the significance? Why is it important that you must study this? especially if you want to look for funding. We talked about funding the first day. How would you convince people or others that what you're doing is important and it's also new and innovative? And then from there, how would you address the question of interest? So for example, if it's a method, what kind of methods would you do? If you're doing something related to biochemistry, how would you do that? Or if it's something related to at the population level, what kind of methods would you use to try to answer the questions that you're coming up with? So so sometimes this is a chart, but it does not necessarily need to go in order, in a specific order. But one thing I would say though is you have to start with the literature review. Know what's available, and then from there you start thinking of what would be next, what's next from doing the literature review, and then that would allow you to then come up with your questions and your hypotheses. So when you want to do when you're trying to identify the research gap, first, what is the topic of interest? What is of interest to you? Can some of you give examples of topics of interest in terms of research? What are you interested in studying? So what are you interested in studying? Those of you who say that you want to study something, can you give an example? So how about give an example from what the projects you're working on? What are you working on? What is the topic?
For me, nutrition.
Okay, so that's very broad. What about nutrition?
That's on children under 5.
Okay, so that's the population that you're targeting, but what about them? What about, so nutrition, children under 5, and then what? What do you want to know about nutrition among children under 5 years old?
Want to know their health status and the nutritionist among the children, like they have been, they are who are stunting, who are wasting, and underweight, and unsure to focus their.
Okay, so you want to do something related to nutrition. You've identified the group that you're interested in. You say children under the age of 5, and you're interested in their nutritional status. So that's an area of interest, the nutritional status of children under age of 5, and how. So that's a topic you're starting out with. And now to become even more specific, you then do some additional literature review to see specifically what about children under 5 and nutrition do you want to study. So an example of a topic also could be, for example, the effect of diet on malnutrition in adults. Or and so from there, you want to ask questions such as what's the exposure? So what is it that they're going to be exposed to that you want to study over time? So for example, meat intake, fruit intake, veggie intake, consumption of nuts, for example. And then your outcome in this example here, what's an outcome of interest? It could be, for example, here we're talking about anemia. Population of interest could be women, in this example, women of childbearing age. And then where would you collect the data? Have the data already been collected, or do you need to go out and collect the data yourself? So these are the first sets of questions that are first steps in identifying the research gap. So once you find a research gap, then you need to also find out more about what's available in the literature. So but then again, as I mentioned, you're doing that simultaneously. So your research gap, you know what you want to study or have an idea of a topic. You're doing literature reviews at the same time and kind of going back and forth. So once you find a research of interest, then you want to do more about knowing what's available in the literature. And the way you do that is by reading, and from there you're able to know what's been explored or what has not been explored enough related to your topic. And and then you do additional literature review to be able to identify even more of the research gap that might be available. So when you're doing your literature review, we need to focus on a few things. And so the first one is, what is currently available? What's the current knowledge related to your topic of interest, related to the outcome that you're looking at? So what is you need to know what's available now to be able to know what you can add to it. And then, is there evidence of changes throughout time of the outcome? So does the knowledge that's currently available, does that change over time? How does it change over time? And also, what are the risk factors? What are the risk factors? What are issues or what are things that can affect or your outcome of your outcome? So these are things that you think about as you're doing your literature review. So with the literature review, you're able to answer questions such as, how is the evidence significant for the research that you want to conduct? Will the evidence you try to find through your literature search, will the evidence that's available support your own research questions that you want to ask? And also, are the arguments clear? And if not, and arguments and results clear in terms of what you want to do, and if not, what is missing? What potential arguments are not addressed already that you can address as your own research question? What evidence do we have? And also, what are the procedures, and are the procedures current? Because procedures change over time. And then also, then we do a systematic process to summarize all the findings. It went as findings from your own literature review. So the research question needs to address a problem that can be solved, right? So we can't say, for example, I want to end world hunger, right? That's very general, and it's not something, I mean, not to be pessimistic, but it's not something that you can solve within a given time period that you have. So we want the question to be very clear. It needs to be very precise, and also something that you can study. So if you say my goal is to end world hunger, that's very broad. Where? Which world? Right? So we need to be very specific, and then also we need to be able to study it. So the study must be able to address the question through data collection, and the method needs to be very precise. It cannot be too abstract. If it's too abstract, then we cannot actually do the work, because it's not concrete enough for you to be able to do something on it. And also, your question needs to be based on evidence. And this goes back again to what we were saying about literature review. We need to have some kind of preliminary evidence that supports the research question. So, does any of you want to share how you came up with your research question for your projects, the projects you're working on? How did you come up with your research questions? How many of you are working on projects here? How many of you are working on projects? Okay, so how did you come up with your question?
Interest of my business questions, especially for these projects. Firstly, that we discuss about the nutrition programs that we focus on in target group, for example, like students, they have also their programs of nutrition, like Laos PDR that we know already for the starting is quite high. And for the adolescents, but for the adolescents, for my area that I focus on the adolescents, why I focus on the adolescents? Because right now that the increasing of the prevalence of obesity and overweight among the adolescents. So that's why this one is quite particular my interest about to know more and to understand more about how the behaviors, eatings of among them, and how can we help them to improve their healthy diets or something like that, and try to review for the materials that they can access right now. For example, like you are going to the school and try to look at what the subject that they provide about nutrition knowledge for them, and this kind of thing that's come up for my research project.
Good. And so how did you know that what you want to do has not been done before?
That's from the that's through this topic, right? For the research reviews that we try to read about the papers that they already published about what we know about them, but and as the limitations of the time to generate the information a lot about the exact problems, but based on the context of the laws. So that's why.
So you did some background work, and then you realized that what you want to study might have been done in other places, but not necessarily in Laos. So that helped you be able to define and make your question a bit more specific, related to the context of Laos, as you said. Okay, very nice. Thank you. So now, once you kind of identify some research gaps and come up with some questions, we now want to say more, we want to go further, come up with specific aims. So the specific aims now start to tell you more about exactly what you want to do. So you've identified a research gap, and now what do you do about it? And what are you going to do? So first, the specific aims are a list of tasks that we propose we'll do in our research. It's a critical part of the study, and it also allows you to be able to precisely state exactly what you want to do, which is important. So we can't say, oh, I want to end world hunger. For example, I use that as an example because it's very broad, and it's very abstract, and it's not concise enough to be able for you to say exactly how you're going to do it. And it's very abstract, but you want your specific aims to be easy to read for anyone, even someone who's not in your field, to be able to read it and say, oh, I have an idea of what this person is interested in doing. So there are some guidelines. The specific aims needs to be very clear. It's easy for for someone to others to understand. So not just for individuals who are specifically in your field. And also we need to say something about what about the exposure, the outcome, and also the population of interest that you want to study. So for example, compare the association between appropriate infant and child feeding practices and the presence of stunting in children less than 5 years old by the Lao PDR province. And it needs to be realistic. So that's what I was saying, that it can't be something that is too abstract, that even trying to tackle it, it would take forever. So it needs to be realistic and also restricted to the available time that you have. So the aims also need to be achievable, something that you have the resources, you're able to achieve with the resources that you have. So for example, we cannot determine stunting without having enough measuring boards to measure height. So you need to have the resources needed to be able to complete the research of interest. And also, we need to avoid vague terms such as bring or show. So bring or show, okay, so what about showing something? What does that give the society? What's the impact of showing something? What do we gain? So using words that are very vague don't really tell us why the research needs to be conducted. So we want to use strong words such as quantify. It's very specific. We want to quantify, estimate, compare, evaluate, identify, and so on. So we want the way we describe the aim to be very specific enough for others to understand. And also we want to avoid, and this is something that it's a little tricky. The aims cannot be too different, right? That it's completely, like the research questions are completely different, that it's not related to one another. And at the same time, it cannot be, in order for you to do the second aim, it cannot depend on whether or not you successfully done the first aim, successfully completed the first aim. So what if you propose a research and your first aim doesn't, and where the second aim depends on whether or not the first aim is successful. So then if the first aim is not successful, then you're not able to do the second aim. Does that make sense? And so, for example, we say we want to develop a validated new food frequency questionnaire for the Laos population. And then evaluate the dietary patterns of the Laos population using the new validated questionnaire. What if you're not successful in validating the questionnaire? Then you can't do aim 2. Right. So we need to be careful that the success of one aim does not fully depend on the other. So all specific aims need to also have hypotheses and also need to be supported by previous evidence. So that's where the literature review comes in, where you know what others have done so that you can know what questions to ask and also provide evidence about what other people have done. We've spent some time talking about hypotheses, and earlier, Nilupa talked about randomized clinical trials, and to do the clinical trials, they had to come up with a hypothesis and then gather data to be able to answer the question of interest, and then do testing. We talked about Z-test or Z-score yesterday as a way of testing a method for testing the hypothesis. So hypothesis states the relationship we expect to observe in our study. What is it? So you've defined your aim. What are the relationships that you expect to have in your study? The hypotheses show indirectly the overall impact of your study. So I mentioned earlier that when we say something like, I want to show, I want to bring, it's not really, those are very vague words. But when you're saying, I want to estimate the effects of this, it's actionable. It's showing that you want to give us a quantity that you're going to estimate. So when you're coming up with your hypotheses, we want to rely mainly on a good literature review. And then that's because based on what others have done, then you can come up with what you want to do and then write a hypothesis. And the rationale must be logical, supported by the previous evidence, and expectations must be reasonable. So when we first start doing research, we're very excited, and we usually promise to do things that we might not be able to do within the time that we have, or even it might be very ambitious. So it's very important for us to think about the hypothesis that I'm thinking of. Is this something that can be accomplished with the time that I have? Is this something, the specific aims that I have, are these questions that can be addressed with the funds that I have, with the resources that I have, and so on? So there are also guidelines. Just as there are guidelines for specific aims, we also have guidelines for hypotheses. So first, we need to clarify what are the variables of interest and the relationship. And so the exposure variable can be a risk factor or a protective factor. So for example, we can look at micronutrient intake, access to vegetables in schools, breastfeeding, level of education. So the exposure is what they're going to be exposed to. And then we're going to see how that changes under certain conditions, under that exposure that they've been exposed to. The outcome is the outcome of interest. How does the exposure influence the outcome of interest? So the disease or health-related behavior or outcome is the outcome variable. Anemia, stunting, underweight, or infant mortality are examples. And now what is the relationship? Do you expect that after being exposed, after your subjects are exposed to the exposure variable, do you expect the outcome to go up or to go down? So what kind of relationship do you expect? Is it a positive one or negative, direct or indirect? For example, exposure to higher maternal education will be associated with less stunting in children. Or a greater access to vegetables in schools will increase levels of vitamin A. And there'll be a positive association between maternal access to nutritional supplements and exclusive breastfeeding. So in the first one, where we say higher maternal education will be associated with less stunting in children, are you expressing in that statement, is that expressing a positive or negative potential association? Is that positive or negative? When we say that higher maternal education will be associated with stunting in children, it's positive. How about greater access to vegetables in schools will increase levels of vitamin A? Okay. And there will be a positive association between maternal access to supplements, nutritional supplements, and exclusive breastfeeding of infants. That one's right. It says there it's positive. Okay. How are we doing with time? I know we have a break. 11. Okay, so we will finish. When is the break? It's 10:45.
Yeah, we're back.
Because I want us to do the teaching discussion. So that's what we're supposed to be doing now.
Tomorrow, that's all.
I think Roger wanted to, okay.
I guess we can probably get started today.
Yeah, to get started, because the confounding stuff I think can do 2 days. Okay, let's take a quick break. I'll finish this up, but I think I want to kind of make sure you guys relax a little bit also and not be sitting there listening to lectures all day. So what we're going to do now is this part is one of those sections where we want you to explore and discuss. We want to make this interactive. And so we have some questions up there that we want you to think about and respond and let's discuss them. Okay. Do you want to go?
Yeah, I can. As Carmen said, this section is going to be the place where we talk, right? So far, we've been doing quite a bit of talking, right? Nindopa, Carmen, we've been talking. So now it's going to be a time for you to talk. And the reason why I think it's always important to know why we want to hear from you, why you got up this morning and you came here, right? So there's something, right? There's a reason why you got up this morning and came here, right? You could have been somewhere else, right? So we want to hear from you. We want to connect with the thing that got us, help us to come, that make us get up this morning and, choose to come here. Let's talk about it. And let's learn from each other what's driving us, why we're here, why when I'm talking about those Greek letters, power, statistics, what?
RCC.
Why?
Anemia.
Sitting here and then you listen. Why? We want to hear from you now, right? So this time it's going to be less about us talking, and it's going to be about you talking. Because once you talk about what you have in your heart and your mind, it becomes, it becomes stronger. You get a stronger connection. Okay, so it's going to be mostly you talking.
Right. So when if you don't answer, we'll just be here in silence. Right. So if you don't speak, we'll just stare at each other.
Okay.
Right. Dr. Rat, can you please translate that? If they don't answer, then we'll also just stay here and and nobody speaks. There's silence. So this is about them speaking.
And everybody will take turn to say something.
มันเพราะฉะนั้นเป็นเรื่องเวลาและที่ทุกท่านจะต้องเบาเบาออกมาเพราะท่านอาจจะเบาได้แต่เนาะก็ไม่เป็น
Okay. So the first question.
Okay, so let's start with the first question. So that's mostly for people who teach, right? So what is teaching to you? If someone asks you, why are you a teacher? You could have been a finance person. You could have been something else. Why are you teaching? What would you tell them? Why are you teaching? Why do you decide to teach?
They must answer now.
Yes. Yes.
And you can start.
บอกอะไรก็แต่ละคนต้องไม่ได้แต่ว่าคนก็ว่าโน้บางทีเลยสิมาเป็นเพื่อนไม่มีบางที No, because I told them they can answer in both languages. Maybe if you strong in English, please English.
Yeah.
Practice English.
Yes, there you go.
Okay, about mistake.
Yeah.
ต้องไปแค่เรื่องงานคนนี้เขาเกินไปเอาเรามาเลยทีละสิเป็นยังจะไปซ่อนลงไปของผมแล้วเขาผมนี่เป็นยังที่ทำลายเอาไปจะไปฟังเลยเป็นยังจะไปซ่อนคน
And if your voice is not too loud, I can get close to you and sing.
จะไปซ่อนนั่นซ่อนไปซ่อนทำยังเป็นยังจะไปซ่อนเขาในความรู้สึกเขาจะประกาศซ่อนเป็นยังมันบ่แม่นทฤษฎี international ทฤษฎีไม่ยังทฤษฎีกับเองไปซ่อนเงินยังเราเป็นอังกฤษเลยมุ้งเห็นภาษาอังกฤษตัวสถานการณ์แบบเราละ
Okay. Because we are trying to send the knowledge to the participants, we need to provide them after they receive for the training or knowledge from the trainer. They will be implementing the activity and to promote on nutrition. That they found the problem that they are implementing. So they need to a guy from the central level on the, for example, on the IMF, for example. So now at the last logo, they found we need children, they are malnutrition. So they do not to understand well the method for the treatment. So after they are received for training, they can do.
Okay. So you, from what I understand, you're saying you want to do, you're teaching because you want to show others how to
do the work, how to do the
work and how to improve the knowledge. And see, he expect after finish the teaching, they will do something, improve something like that. For example, the treatment as he mentioned. Maybe if after finish the training, they can
treat the patient, call it really different thing.
Okay, nice. Anybody else?
That's why what is the teaching to you? That's for me, the education teaching is like sharing knowledge and experience to another person. And also, I am at University of Science, and it to be the teacher in the future also. And if I get today, for this course, I have the knowledge, I get the input, some techniques here for the startup, and also transfer the knowledge to the students. Yeah, through my friends, I can speak or something like that. Yeah.
So share the knowledge, right? Share what he knows, learn, and then share, help other people, right? Okay. Who else? Who else wants to say?
พ่อแม่ก็ได้เป็นอาจารย์สอนมีบุคคลสอนไปถึงจาก
สมัครงานจากนี้จากด้วยดังนั้นเพราะว่าจะทำได้
Okay, anybody else on that? Okay, so the next one, why does teaching matter? Why does teaching matter to you?
เอาบ่ได้บอกว่าที่จะบอกว่าแต่ก็ยังบอกถึงกูว่าที่ชิมมันเอง
เป็นอย่างการสอนสิ่งสำคัญกับเจ้า
And I think it's true that we put teaching there, but it can be really what you do matters, right? It can be that you do research, work for government, or why do you think what you do matters, right? So it doesn't have to be only teaching. It can be something else, right? Okay.
Yeah, may I share?
Yes, of course.
On behalf of a teacher, and of course, the learner for a long time. A teacher is a learner, and a learner can be a teacher at the same time for me. So, teaching to me is sharing for me without any expectations. Just share what I know. Depends on the learner or the receiver to use it in what ways. So I don't expect that much from them, or I don't know what to expect from them. But the only thing I expect is to give them pure from what I know. That's the teaching. For me myself, I started teaching when I was in secondary school for basic English to earn money. I have no money for school, no money for gasoline or even life. I had to arrive a very old bus to go to school, to secondary school. So I have some basic knowledge of English. I started teaching. So I didn't even know how I love it or not, but it is good to do so. I can value myself. When I get questions from my students, every time they talk to me, I feel I value myself. So that's the teaching to me. Okay. So at the same time, all the students can be my teachers. So teaching is a two-way communication, interactive exchange of information and even skill. So why teaching matters to me, of course, it increases the value that we see ourselves. Whatever the change will be big or small, we can't foresee it for certain reason. But it matters for sure in the future that what we teach can the benefit come back to us in something that is visible or invisible. Yeah. So teaching matters for the value of ourselves and everyone as well.
That's excellent. That's great.
Yes, that's very important to also put not only about sharing with others, but also what you get from it. I think that's important, especially when, you know, teaching is nice, but there are days where you question yourself. Why am I teaching? Why am I doing this? And then when you remind yourself of why you're doing it, I think it and you know why you're doing it and what you gain from it. It's not just you outputting information, but you also gain from sharing, and then you learn from your students or people you're teaching. I think it reminds you that it's an exchange of information with people that you are teaching. So that's important. Anybody else?
For the specifically why the teaching matter in the forming, because the future is so important, and also the teaching is really important. For all of us also in the sharing our lives, and if we have the knowledge to share our life to be better or get a good job or something like that, and also to lie the children to the society to get the knowledge or something like that. Yeah.
Absolutely. I love that. Yeah. Anybody else? Nobody on this table. One person from this table. You've been very quiet. One person from this table, not including the Lupa. One person from, and you can speak in Lao. Dr. Rat would translate.
That's me, the children, they laugh
Answer first for you. It moves the world, but it stops the world.
và làm sao thì mình sẽ thành làm bệnh viện như là phải so thì nhá thì không cần
Hold on, what I said.
có nên lên là có những cái tuần dòng
ตัวการสอนเป็นการทรงตัวองค์นู้จะเห็นงานสามารถแชร์ค่ะขนาดทรงตัวองค์นู้เป็นได้หลายเนาะฉะนั้นสำคัญก็คือทั้งสองฝ่ายผู้สอนและการผู้รับน้ำกันซึ่งสำคัญคือเป็นให้คุณมองผู้สอนกับตัวหมายความว่าจะได้สอนทุกอย่างจะได้รับจากอยู่ที่คำถามว่าบางครั้งบางการจะได้คิดคำถามนั้นขึ้นมาจะได้ถามเหตุได้ว่ามันเป็นการได้เปลี่ยนคนคนได้สอน
For the second question, is that we want to share the knowledge to other people, and at the same time, we want to learn from participants as well. Because some point the lecturer or the teacher didn't know everything, but sometimes we have to learn from participants as well and transfer the knowledge to other people.
Okay, thank you. Thank you. And the next one, you want to ask the next one?
Yeah. So what is research to you? I think that's
การคุ้นควรนี่เป็นอย่างไรผมที่เขาเราคือการคุ้นควรนี่เป็นอย่างนี้ก็ไม่ยากไม่ยากเป็นอาจารย์ก็ไม่ยากเรื่องที่เป็นนักเรียนคือเราไล่
in other words, and again, I think it doesn't have to be research related. Again, related to
เป็นอย่างจริงว่าเห็นเจออย่างจริงเป็นอย่างเป็นอย่างจริงเป็นการคุ้นควรเห็นเราไปพรีเซนต์อยู่กองกระทรวงสร้างคนซื่อๆว่าเรื่องเราไปอย่างเจอเป็นอย่างเราที่
it can be research or it can be what you do. What is that you do and why you think it's important?
Yeah, actually, I'm thinking of maybe reframing that. So how many of you do something related to nutrition?
ที่วันนี้มีค่าเดชิวาที่อันได้เรียนเกี่ยวข้องกับโภชนาการเป็นหมวดที่ไม่ต้องเล่ามีเหตุตลอดเลยที่
So the question.
แต่น่าจะได้ให้ดีไซน์เลยอย่างไปเรียนรู้ข้อโภชนาการมันก็ได้ไม่ได้ไม่ได้อย่าง
So the question is, why did you choose nutrition?
เป็นอย่างของที่เลือกโภชนาการ
So everybody who likes nutrition will say.
Yeah. So how many people are doing nutrition or interested in nutrition? Oh, no, now the hands are down. So how many people are doing something related to nutrition here? Do you need?
โอ้กดมาเชื่อตัวเองก็เรียนอย่างโภชนาการได้ใจกันอยู่คนยอมเนี่ย
Okay.
So no, none of, so let's ask the question again. How many people here are doing something related to nutrition?
ที่นั่นนี่มีค่าใดที่มาเฮ็ดอันนั้นเป็นการที่มันเกี่ยวข้องกับโภชนาการลงขึ้นเอาก่อนที่เราแรกก็เป็นคนนั้นค่ะการจะเป็นโภชนาการเนี่ยกินอยู่ในนอกฟู้ดเซฟตี้มันก็เกี่ยวกับโภชนาการมันต้องมีชื่อว่าโภชนาการ
So you want each one of them to go and say something? Okay, so we'll start here and everybody will say why they chose nutrition.
เอาเลยเอาthe name people are
This for me is just a little bit about the nutrition, but for me it's mean like a share the different idea. Want to exchange another people for me because I think is the idea is really important about the nutrition because we cannot expect everything from nutrition, but when you ask or listen to idea, we can change the idea or mind. And the thing is like we get along with each other about the urban and rural area. They're gonna make interested for me.
Thank you.
So actually, but nutrition is integrated to my field. So actually, we are working in this central area and try to encourage the local people to have a good diet and particularly vegetarian and plant and pregnant.
Okay, thank you.
That's for me, I don't have experience for the research for the field of nutrition before, but I so interested for this course also for nutrition. In the future, maybe I go to the link of the nutrition to my research or research in the future also. But I see in the at least the some journal is so important and there's the evidence or research of nutrition in Lao so much. I think it's very important for research of the nutrition. In the future, you probably will do research about it. Yeah.
Okay, thank you. Michael?
Okay. Yes, the nutrition is my life simple until die. Because
Did I hear you?
right is during season is to make you healthy, you have to travel, your brain is growing up. So and then I think the nutrition is very, very important. Make your life longer, make you have save money, like you have healthy, you have good nutrition, and then you not to spend for your health expenditure, your treatment, or if you have healthy nutrition, good, so that you have strong, you have save money for treat yourself.
you are what you eat. They are what you are what you eat.
You are what you eat. Yes, you are what you eat.
Excellent, that's great.
Yes,
We skip everything.
no, we will not skip anybody.
Oh, research to me.
No, nutrition.
Yes, to me, nutrition. It is one of the most important things in life because nutrition defines of course you are what you eat. Yeah, nutrition is not only about food. It relates to behaviors, related to the vision of the society. It's related to the decision making of the whole population, the whole community. That directly affect the health status or influence of good health. So whatever happens to health and environment, nutrition is considered to be a center of consideration on quality of life. That's what I see on nutrition. So research in nutrition can make us taller and taller. every move research, you know what I mean? So I'm trying to stand on your shoulders because we are all doing research. We are trying to get from each other, and we want to see further and further. So and there are still a lot more to learn about nutrition.
Yeah.
What we know is just only a few things, and even the tool we are using right now is still limited to catch exact the fact related the fact about nutrition. So nutrition to me is a kind of very large planet for us to find out all the resources in it. Thank you.
Thank you. Yes.
In addition, for me, why I want needed to be that as many people that have for health and other women as well. As we are, I agree with Azala that she said that we are working. So that's why and I mentioned earlier about why I interested to more understand about nutrition among the people, and not only this group as well, but as we know, the problems of the nutrition is quite related to the many areas of the abilities of the people. It's like the quality of life. For example, like the abilities of working, it's quite related to the physical and mental health as well. For example, like we can compare between the malnutrition and healthy people. The mental health is different, right? It's not affect only it's not only the environmental effect on the mental health, but also the bodily effect to your mental health as well. So that's why I think the nutrition is quite gathers the interesting from other people's, not just me and not just the people in this room and other people outside the room as well. So that's why that nutrition is quite
Excellent.
considerate topic.
Wow, okay. How about you? Thank you. How about you?
สิขออนุญาตให้อาจารย์ผมว่าสิขอความว่าประทับอันน่ะส่วนตัวมันจะจอมในหลังอาจารย์เกษตรเนาะก็คือในภาควิชาเศรษฐกิจเกษตรกรรมและเทคโนโลยีอาหาร
He come from agriculture on the agriculture economic hub and food technology ว่าภาษาอังกฤษเลยว่าพวกมึงสับกันกัน
ท่านมาก็คือโมเดลเกี่ยวกับอนาคตแห่งการแต่ว่าคือที่มองอย่างอาจารย์เศรษฐศิลป์
In the past, he never do something related to nutrition.
ในวิชาหลักๆแม่เกี่ยวกับพัฒนาสังคมเศรษฐกิจเกษตรกรรม
The main area of his responsibility on the community development and agriculture.
แล้วมานี่ก็คือมีจุดประสงค์แปลว่าเรื่องของพัฒนาเรื่องความรู้และเรื่องประสบการณ์ในการใช้ระบบแห่งสกัดได้
He come here because he expect to improve knowledge on the how to do the standard program.
Stata. Okay. All right. That's good to know. Okay. Good. Thank you. Yes.
Don't care about your mistake. Yeah.
อยากให้ว่านะว่า my English is not very well ข้าพเจ้ามาจากศูนย์คุณพ่อเข้าและฝึกเศรษฐกิจของจุฬาภรณ์เวลาเขาจะพูดว่าศูนย์ทางคำ
He come from the Rai Research Center.
ข้าพเจ้าอยู่ในงานภูมิแห่งกสิกรรมก็คือน้องจะลงลึกในด้านแปรรูปซึ่งในศูนย์เราที่เกี่ยวกับ
แต่รูปคือเศรษฐกิจก็จะเป็นประเภททัวร์เป็นตัวดีเป็นตัวเรือตัวเขียว
responsibility on food processing.
อืม
For example, the product for the bean product, like the soybean come to be the sausage. Something about. Ama tu ama it nam tak punya kat nam. Gome. Gome
กับโซดิวคุกกี้
Yeah.
แล้วก็สแน็คธรรมดาที่ได้
Like the snack or something like that. Họ có lịch đây và như vậy.
ที่คนละที่คนละจะเอาสิก็มีส่วนหนึ่งโดยที่ต้องผ่านผ่านแบบที่นี่ซื้อ
But he expect this one not relevant to nutrition. That impact.
yeah
มาผมแล้วนี่กันได้มาแข่งพวกหน้าไปแล้ว
He come to this training because he trained the boss. Because saying his boss name come and then his boss go to other country. That's why he come to.
okay okay
มาผมจำที่ผมเคยอยากมีผู้ความประสบการณ์มาในพัฒนาเสริมโตคือที่เราดูแลส่วนหลายสินค้าของบ้านเรามันนำมาจากต่างประเทศนำเข้าประเทศแล้วยิ่งในการลงเลือกเกี่ยวกับการพัฒนาศักยภาพของเราดีขึ้น
For this training, we expect to learn something new because the product in our country just import. That's why we want to improve the quality of food processing in his lab.
that's nice okay thank you
การทำงานนะครับว่าจะลงเกี่ยวกับการจะอยู่ใน
For the next very near future, he will do some research how to improve the soybean soy sauce here. Okay.
nice
Nice.
a very specific topic research topic yes okay who's next thank you
Thank you.
who's next
ก็อยากให้จะเข้าใจก็ต้องเข้าใจด้วยจานเปย์อะไรจานอีกลิโตแค่ก็เข้าใจโดยอาจารย์สำหรับนอกเองกับเรียนหลังบ่ายค่ะคณะของเราค่ะอาจารย์สิงคโปร์เดินจริงสกูลโฆษณาการเราสำหรับเราเองเนาะเวลาเราอยากเก็บโฆษณาการนี้ก็ยังว่าเนื่องกับเป็นเรื่องที่สำคัญอาจารย์เรื่องโฆษณาการจะเล่าถึงอาหารเนาะแล้ววันนี้สำหรับตัวข้าพเจ้าเองกับแม่นันอยากพูเนาะเพราะว่าอาหารมันเป็นที่ที่สำคัญเพื่อให้สุขภาพเราแข็งแรงเนาะแล้วก็อย่าเอาความรู้นี้ไปถ่ายทอดให้นักศึกษาแต่การคือเท่ให้รู้ให้ท่วงขึ้นเนาะเรื่องเกี่ยวกับอาหาร She said nutrition is important for her because nutrition she mentioned about food how important how can eat or something like that. So she expect to get some new knowledge of nutrition to teach other teacher and students.
okay all right thank you
วันนี้ค่ะเราอาจารย์เพราะว่าข้ออะไรเราเลยสำหรับอันโตพระเจ้าเองเรื่องเกี่ยวกับพัฒนาการนี่คือว่าโบเคยได้ให้เรียกเกี่ยวกับพัฒนาการแต่ว่ามีความเกี่ยวกับโฆษณาการเพราะว่าส่วนตัวเองคิดว่าการถ้าเราได้บริโภคอาหารที่ดีจะยังให้สุขภาพเราดีเนาะและลดค่าใช้จ่ายที่ว่าเกิดจากการกินอาหารที่บ่ดีลดค่าการเจ็บเป็นโควิด19เพราะว่าส่วนตัวเคยได้ไปเฮ็ดเวียกอยู่เขตนอกเนาะอาจารย์อยู่ติดกับชายแดนนะบ้านสุนเผ่าเขาเห็นเด็กน้อยนะที่ว่าเขาเจ้ามีปัญหาเรื่องโฆษณาการมีหลายหนูก็เลยว่าคันถ้าว่ามีโอกาสที่ว่าได้เข้าร่วมการฝึกอบรมอย่างทางด้านโฆษณาการอย่างใดอย่างหนึ่งเนาะหรือว่ามีโอกาสนะอยากเข้าร่วมและการหวังว่าคันถ้ามีโอกาสจะได้ไปให้ทุกการศึกษาหรือได้ไปแนะนำเขาเจ้านะให้เขาเจ้ารู้เกี่ยวกับเรื่องอาหารการกินให้เพื่อให้เขาเจ้าสุขภาพเขาเจ้าแข็งแรงขึ้นคันถ้าเขา
ข้าเจ้าได้กินอาหารดีแต่น้อยเนาะการเจริญเติบโตของข้าเจ้าก็จะดีขึ้นและเฮ็ดให้สมองข้าเจ้ามีการพัฒนาหลายขึ้นซึ่งอยู่นอกคณะบ่แม่นว่าข้าเจ้าบ่มีอันกินในการเป็นผักเป็นหมั่งไม้เป็นอีหยังต่างๆคณะข้าเจ้ามีต่างแต่ว่าข้าเจ้าบ่รู้อาจารย์ข้าเจ้าบ่รู้ที่ว่าจะเอาอันมาเฮ็ดกินจังไดให้มันดีต่อสุขภาพนะส่วนหลายแต่กินแต่อยู่บ้านนอกบ้านนาเฮาให้หลายกว่า
She said her daily work not related to the nutrition, but she said the nutrition very important to her because when she went to the outside to the community, she saw the high rate of malnutrition among the children. So she want to get the knowledge on nutrition. You have the opportunity to do the counseling or provide knowledge to the people at the community how to improve nutrition. Because nutrition is very important for the brain development. If you eat something good, your brain will be good.
Thank you.
Yes, because like it's done well.
But you just said that in English.
เพราะว่าที่มีความสนใจในรีเสิร์ชเกี่ยวกับ nutrition นะเพราะว่าในประเทศเรายังมีปัญหาเกี่ยวกับการทานสารอาหารที่หลายแล้วถ้าว่ายังมีหลายที่ทางแก้ปัญหาที่เราที่ว่าโฆษณาการเป็นมีความสำคัญหน่อยนับฉันเป็นถือผ้าฉันเป็นด้วยวิกรถือผ้าก็ต้องฉะนั้นจึงเห็นว่าในเวลายังมีปัญหาที่จะมีความสนใจย้อนมาใน
That's interesting on the nutrition research because the high malnutrition, the Lao PDR still have high rate of malnutrition. So she want to interest to know how to improve because nutrition is very important for pregnant women until elderly.
Yes. Okay. Thank you.
แต่ที่ว่าจะเกี่ยวกับเรื่องโฆษณาการเนาะในบ้านเราคืออะไรคุณต้องการเนาะเพราะบ้านเรายังมีปัญหาเรื่องโฆษณาการหลายเพราะว่านักตั้งใจได้เข้าถึงอายุสูงคนที่อายุไทยยังมีปัญหาเรื่องนี้ดูการเป็นของพ่อที่ว่าเกี่ยวกับโฆษณาการช่วยต่อยในการแบบว่ามีหลักฐานมีข้อมูลในการแก้ไขปัญหาใช่แบบว่ามีการมีข้อมูลเพื่อให้ทางคันเทนมีนโยบายออกมาเพื่อป้องกันแก้ไขปัญหาที่มันเกิดขึ้นในปัจจุบัน
She says she's interested on the nutrition research because she want to do the research to get the evidence to show the decision maker level or policy maker to say, oh, this is we have a problem like this and how to improve to develop some policy and strategy to support how to improve the nutrition. Because in Lao PDR, we have a program for the children until elderly.
Mhm. Thank you.
For me, I have research about nutrition when I was studying master's degree. At that time, my topic is to estimate the period of overweight and obesity in the children at the elementary school. And after that, I just joined the fieldwork about the project to improve the nutrition at the rural area, improve the health system, and that is a long time. So. And after that, I didn't join another project about the nutrition. I joined another project about the infection disease. And to come here for training about the analysis is important to me. That they will improve and have review my experience about the methodology and analysis.
Very nice. Thank you.
Short answer for me. Nutrition education for good health and good consumption and for exercising and because I want to about the application of nutrition to exercise.
Thank you.
ค่ะน้องโตคือเสือ
จำใส่ที่ร้านกันนะครับที่พอโล่งเอง
ก็ดับเบิลเราไม่ชื่อหมดไหนแต่ต่างต่างไหน
เพราะว่าที่จริงอ่ะเพราะว่า
ซีเลอร์อีริส no but not brave enough to speak out you know
อาจารย์ใช้ปัญหาในโซซีเนาะที่จริงอ่ะก็เป็นอย่างที่ที่ทางแต่เพราะว่าของน้องเหมือนเป็นไงเรื่องมันจากการเป็นคนมาก่อนแล้วกันเขาอยู่ที่นี่เป็นแผนกคนครัวแล้วก็เลยมีความสนใจในตัวเองเนี่ยโฆษณาการเนี่ยในหัวข้อที่ปฏิบัติที่แบบคือตอนนอกมาจากอินซูลินเขาเคยได้ยังไงที่เขาเป็นผู้คิดพอสวยก็เลยข้อที่สองก็เลยมาเกี่ยวกับเรื่องการพฤติกรรมการบริโภคอาหารและขนมเครื่องดื่มของหวานที่มีบทต้องกับว่าโฆษณาการการหลักๆของมันที่นี่
because her work related to the research and nutrition and she study on nutrition that's why she must continue to work on nutrition and see you to do the non-communicable disease that's why she want to know more about how the status of the incident.
Thank you.
Thank you.
For the question that why are you doing the research, right? Totally, I agree with all participants and their answer. So I just ask one minute, like because I am interesting for the research. That's why the research can help the people to find into after we are find the issue that we can make the summary for the and report to the leader to make a plan to solving those issues.
Okay, thank you.
อันนั้นที่ขอแล้ว
The hot out.
สำหรับอันนั้นเป็นอย่างที่เหตุการณ์ส่วนบ้านอย่างที่ถึงเกี่ยวกับผู้ที่ประชาชนที่จะเข้าถึงอาหารที่เกี่ยวกับสำหรับในมาสำหรับอันก้อนหรือพาต่างหรือพาเป็นอย่างที่จะต้องเป็นการกินอาหารแล้วทำให้มีส่วนประโยชน์และการก่อนนั้นที่จะทำให้สุขภาพดีพอเด็กในท้องแล้วหลังจากเกิดการให้เด็กน้อยสุขภาพดีแล้วก็มีจุดอ่อนเป็น5 ปีเลย
USAID did the nutrition research because want to know the situation of food consumption among pregnant women and their children after birth and pregnant and birth and then want to know how do they eat and want to get the data to change behavior of the dietary intake เข้าไปตามประธานหัวเอาแล้วนะภาษาอังกฤษที่อาจารย์ใจเย็นกับน้องเป็นภาษาดีเลย
So you've all had a chance to think about what nutrition is to you, what is research to you, why are you doing research in nutrition, or why are you interested in nutrition? I believe it's important to ask these questions often, to ask yourself very regularly, especially when you start a new research topic or even when you're doing something you've already been doing, to ask yourself regularly, why am I doing this? Why is this important? Because it's easy to keep doing and forget why you're doing what you're doing. So what we hoped from this section that we just did was to really get you thinking and to also have each one of you interact so we can interact with each other. But more importantly, for you to also start asking yourselves these questions because I believe it's important. It's important to be successful in the field, and it's also important to help you come up with new questions to answer. Okay,
All right. I think with that,
we will have lunch.
almost lunchtime. Yes.
Next question to Sir Roger or even comment, or why are you interested in biostatistics a lot? It's rare. We have a question for you.
Yes.
Short answer.
Short answer.
Just why
Why biostatistics? Why we?
So, I've seen somewhere where it was written, I forgot the guy now. Well, I think someone asked him what's the definition of biostatistics, and he believes that, God speak to us through biostatistics and statistics. And his reason is the following. It's like biostatistics help us to sort of understand what nature is trying to tell us while removing all the biases that you as human can bring into whatever study or whatever problems you're trying to study. So that's of course if biostatistics is properly, the techniques are properly applied. So I chose, well, I don't think I'll go as far as using that definition exactly, but I think I chose statistics because I think it's one of those rare fields where you have the opportunity to working with other people, where you get to, for a project or two, you get to learn about what other people are working on. I'm not a nutritionist. I don't know, I wasn't trained in nutrition. I wasn't trained in physiologist. I don't know much about, I wasn't trained in, I don't have a PhD in physiology or physical activity, but yet I have a level of understanding that allows me to, help other people answer interesting questions. So for me, it was something that I enjoy, doing, helping other people, learning about other fields. So that's for me the reason why I chose biostatistics.
Yeah, I think I think biostatistics for me is a field that you'll never be bored. You'll never be bored because it can be applied to so many different areas. And so with someone who has an interest in so many different areas, I feel like actually to answer that question simply, I chose biostatistics or statistics when I was younger because I couldn't decide what to study. That's actually the truth. I had an interest in engineering. I had an interest in mathematics. I had an interest in so many different fields, and I could not choose one. And I had an interest in going to medical school. So then I decided, well, I had to do it, what can I do that allows me to not choose? And it was actually statistics. And then once I did statistics, I realized I do want to know more about health, and then biostatistics. So I think that's the short answer, because I couldn't decide what I wanted to do. So I get to do everything that I want to do with statistics.
Thank you.
And Nilupa is also, we can ask Nilupa in the back.
It's nice to do this reflection. I think maybe three reasons. So I think, how should I say? So I'm from a small country that is still developing, and I work in a lot of other developing countries, and we have big problems and that need some kind of solutions. And there are so many bad methods that in the current world, people work very hard, but their methods are sometimes can be improved. Our research methods, our data collection, how we use data, and that has consequences for how well we can solve problems. We don't have the right methods, right? And so we have to improve in order to solve these problems. And so we really need these methods
in order to find solutions for the problems our countries have. So that's one big motivation. I think personally, it also helps me understand how the world works. Like it just helps my understanding of a confusing world. To be able to study these things and to learn how things are how they truly are. And then also I work in very vulnerable populations. And a lot of times they're people who are just not part of anything. Like they have no ability to speak or have a voice, and it's their data that does the speaking. Otherwise, they have no voice at all. And so when you get data from people who are so disadvantaged, you give them an opportunity for their experience to be recognized by the broader society, so they're not forgotten. So I think that's also very important.
Great. Thank you.
And I think what I love is that I can always answer the question by it depends.
It depends.
Whatever question you ask me, I'm like, it depends. I love
It's
that.
just plus or minus.
It's just it depends. So
Thank you. I think statistics is like a song.
it depends.
It needs an amplifier, a very good amplifier to make it look noise. Thank you.
All right. Yeah.
Okay, thank you all.
So, okay. So let's get started. We're gonna continue where we left off yesterday, right? So we're gonna continue again. We're gonna talk about hypothesis testing, right? As I say, it's so important because anytime you want to convince somebody, you want to show that what you're saying, what you think, that what you're saying is true, you have to show them scientific. So in the street, at home is enough to say, trust me, I know, trust me. But if you want to convince people outside of home and stuff, you have to show them scientific evidence. You have to do hypothesis testing, right? So that's so important. So that's the reason why I'm spending some time to really help you to understand when you can use it, right? And I think in most of your work, you will see that there are areas where you need to use it, where it makes sense, right? Okay. And today, when we were talking today, one of the key themes, the big idea of what you guys were saying is that there is a problem. I think I can be part of the solution. I think I can come up with a way, right? I have an idea, but at least if I don't have it right now, I'm thinking about an idea so that we solve the problem, right? Essentially, that's all you were saying. We have a problem. There is a problem. There's always a problem. There's always going to be a problem. I have an idea. I have to solve it. Now, what's going to be hard, you just cannot walk in front of the minister to tell him, trust me, I'm right. You have to show him data. Right? You have to show him data. You have to do research. You have to do it. You have to tell him I'm right. Why? Because I'm doing good statistics. I'm doing hypothesis testing. I'm rigorous. I'm following the rules of statistics. And nobody can argue once you follow the rules of statistics. Nobody can argue with your result. Okay? So that's the reason why it's so important for you to learn those rules, to understand when to use it. Okay? All right? Okay. So I'm going to start with a small example here. So for this, what I'm going to do, I'm going to be jumping between apply or Stata, because I really want to show you Stata. And I'm going to be jumping between Stata and my lecture notes. Okay. So this here is a data set that we got from the national survey, right? And so for right. So if you've never seen what data looks like, that's really what it looks like, right? What does the window look like? That's really what I told you last time in the lecture a little bit, right? That's how it looks like. And so the good thing is, most cases, right, is that you open data, you know, I assume that you already did your study. People work hard to collect the data. They did a good job in labeling all the data, all the variables. You know what the variables are. You see how this is? In here, the variable, I have a set of variables. And for this variable, I have a description, for example, right? So this variable in my data set, right? So here I have my data set. And one way to view the data set is really to go here, right? And then open up like this. See? This is my data set over here. Can you guys see? Let me zoom a little bit, maybe. All right, maybe. That's good. It's a little bit better. All right. This is what my data looks like. Right? It's data matrix. The columns are what? The columns are the variables, right? What I measure about people. And the rows are participants, study participant, excellent. Study participant. Okay? All right? That's what the data looks like. So sometimes, most of the time, you have variables, the name is too long, but you don't really want to use a long name. So what we do, we use just short name. But now you have to describe to me what these are. Because after you do the study, right, after you collect the data, if someone else, if you want to share the data with me, it's like, hey, Roger, but guess what? We have a problem here, and I think you can help me with this. You can do the analysis, right? Well, so you're going to send me the data in the US, right? You will not be there, right? But when you send me the data, if you do a good job in labeling it with variables, I know what variables they are. Does it make sense? Right? And so that's really what I have here on the left, on the right-hand side here. You see, I have those labels here, right? I'm trying to see how I can magnify it, but it looks like it's a bit difficult. For example, the variable called AN1 is what? That's the cluster number, right? Because, you know, I did a little bit of, I had the sampling, so I had clusters and so on going on, right? But AN11 is what? The child length or height in centimeter. You see, right? I'm telling you what this variable is. I'm telling you the units. I'm providing you so much information so that when you did the data set, someone else has access to the data set, but they know what they are. They know what those variables are. Okay? All right. And for you also, after you've done the study 5-10 years later, when someone calls you, it's like, well, look at the data. I gave you the name there. And then you go see the name. Right? So you have to document it. Everything you do, you have to document nicely. It's good for you. It avoids mistakes. But then it allows you to, once you move on to a project, you can sometimes you start a project, you don't finish, right? And then you promote it to something else, right? Another position. But someone else is going to come, right? Someone else is going to be there. And so once you do that, someone else can come up and work, and then it's not too hard for them to try to figure out what you did, right? Okay? So that's what, in a nutshell, that's really what data looks like, right? Okay, these are the variables. You have labels here that explain to you what these variables are, and then you have the columns. Okay, all right. And so I have an Excel sheet importing this data. So currently my data set is in Stata. So once it is in Stata, then I can ask questions. I can tell Stata to do stuff with the data set it has in mind. Okay, all right. So for example, right now, I told you that the best way to tell Stata to do, you have to tell him the command. But my biggest recommendation to you, as I stressed last time on, was what? If you work with Stata, you gotta have a do file, right? Whenever you work with Stata, you have to have a do file. If someone tells you they work with Stata, the first question you ask them is, what? Do you have a do file? If you don't have a do file, you say, I'm not ready to talk to you yet. Talk to me when you have a do file. Okay? Gotta have a do file. You gotta have a do file. Why? Again, for the same idea. You can start a project, and then, you know, you get more money, you get, hey, you're the director now you move up. Someone else needs to work on the project, needs to keep going. When you have a do file, I can come, you can send me the do file if you need help. And I can look at the do file and I know what you did. And you don't have, while you're sleeping here, I'm working over there and I know what you're doing, what you did, okay? All right, so you have to have the do file, it's important, okay? So I have a do file, right? And then, so this is really what the do file looks like here, right? You see here, I've commented, nicely commented stuff. You know, I tell you exactly what to do. If you want to find the mean of a variable, just take the mean, the variable. I mean, it's really nice, right? Remember the comment, I told you, everything you see in green there, I comment. What it means is, Stata, this is not a language Stata speak. It's like me speaking to you in Portuguese. Maybe some people could understand Portuguese, but you'll be like, I don't know what this is, right? Okay, all right? And so green means comment. Stata doesn't understand that. But color means, wait, Stata's gonna try to understand that. If Stata doesn't understand it, guess what happened? He gets mad and he gives you error. He gives you a red word. I don't know what this is. Okay, all right. So that's the idea there. And of course, you know, as I say, you know, I'm nicely commenting this here. All right. So suppose, right, I have a variable. All right, I have a variable called cage, right? Let's see what cage is. Suppose I don't know what cage is, right? Let's see what cage is. Let's see what cage is. Oh, let me come down here. I told you last time that there are ways we can do this. We can do this by looking at cage, right? Cage here, that's age in month. You see that, right? I say, look for the variable called cage. Instead, I came, hey, we got multiple variables with cage in it. One of them is this, age in month. Another one is cage 6, age in month as well, and various months. But I want the first one. But somehow, I would like to know, right? So that's a variable of interest that I have right now. Let's put it that way. And then somehow I would like to test an hypothesis, do something with cage, right? I like to do something with cage. I'm not going to tell you exactly what it is, but I want to do something with cage. All right. So I told you that you have to have a do file, right? So once you have a do file, here you write a command, but now you need to send those commands to Stata. So it's like sending a letter to Stata. Hey, Stata, can you do this for me? And then Stata respond to you as well, right? So now in this do file, I'm not going to get any result. I need to send this to Stata. How do I do this? Well, there's where I can do it. So I can select what I want to do there, right? I can select what I want to do there, and then I come over here and then run selection. I can do run selection right here, and guess what happened? You see, right? This command here was sent to Stata, and this is the output I did. That's the output that I got. Yeah, does it make sense? Everybody? Yeah. Can you see? Can you see the comment? Can you see? Yeah.
Yes.
Let me make it bigger.
Right.
All right. I selected the command and I sent it to Stata. All right. So you lead the project, and then reports. In one of the reports, you see an output like this from Stata. What do you think happens here? It's something we've seen before, yesterday. What happened? How do you interpret this result here that you have? How do you make sense of this output you have over here? What do you think is happening over here? What I have selected, what do you think is happening? What am I doing? Is what? Yeah, well, that's the output, but what is that? Let's put it this way. So remember, I just sent a letter to Stata. Stata responded. I want you to tell me what I wrote in the letter. What I asked Stata. Why state are responded to me this way?
You tested the hypothesis.
Excellent. Right? I tested an hypothesis. What's my null hypothesis? Age was what? Age in month. Right. So what is my null hypothesis?
The age in month.
The what?
Age in month is
Is equal to what? What's the null hypothesis? The average age for the kids from which are average age of the kids in the population from which I got the sample from, their average age is 36 what? Months. Because the unit of age is months. So 36 months. That's what I'm testing. So my null hypothesis here is saying the average age of a kid, right, in the population where I got the sample from, the average age is equal to 36. I want to test that. Is there evidence to believe that the average age in the population is equal to 36? All right? Okay? There's something else I'm doing here as well. Remember yesterday we talked about the t-test, right? That was right before our chicken dance. You remember that? Right before that, we talked about the t-test. What's the difference between the t-test and, first of all, what test am I using here? Let's start with that. I'm using the z-test. Now, what's the difference between the z-test and the t-test? Is what? No, I don't have two groups here. I have what? I have one group here. I only have one group here, right? So what? What's the difference between the z-test and the t-test?
Z-test is compare the group with the value with the number, and the t-test is compare between the number.
No, so I still can use a z-test for one group. So I can use a t-test. I can use a t-test and a z-test for one group. If I want to test one group, I still can use a z-test or I can use a t-test. But there is something I'm assuming when I use a z-test. What is it? No, not quite. I'm assuming that, look what's happening here. Look what I'm doing here. You see here? I'm assuming that I know the standard deviation. I know that the standard deviation is 17. I'm assuming that I know the standard deviation. Right? That's when I can use the z-test. Of course, I'm also assuming other things, right? But I'm assuming the data is normal also. But certainly I'm assuming here I know the standard deviation. Okay? All right? I'm assuming I know the standard deviation. That's why I can use the z-test. Okay? All right? Now, well, you asked a question earlier. You say, hey, can we have a case where the test statistics is significant and then in some other case scenario, it's just not, right? So, let me go back here. So, I've tested the null hypothesis that the average age of a kid in the population of interest there is equal to 36 months. Suppose that my alternative claims, an alternative says that the average age is actually different from 36. What is the p-value for my test statistics, for my z-test? What's the p-value? And what is the conclusion I will make based on this analysis? What is the p-value? I'm assuming that the alternative is that mu, the average age of those kids in their population, the average age is different than 36. Okay? Now, I want to know what is the p-value and what's the conclusion you will make based on this outcome, based on this output. Okay, so someone just, yeah, speak up.
And based on your
I can hear you. Go ahead.
based on your known hypothesis in here,
Yeah.
and so you conclude with the p-value. The p-value is less than 0.001.
Okay, so why?
And
Why?
we,
Oh, because I have a p-value here is 1.
but that's not your non-hypothesis. Your alternative hypothesis. That's not
So which one should I use?
the middle one.
The middle one? Excellent. All right. The middle one. Nice. The middle one is the one I really want to look at, right? Because that's the one that states mean is different from 36. Okay. And the p-value is what? 0.00000 something, right? Very small p-value. And then if I have a significance level of 5%, what happened here? I will reject the null hypothesis and claim that there's not even enough evidence to claim that the average mean of a skate is actually equal to 36. I will reject the null hypothesis. Okay? Now, suppose that, remember, to do this, I assume that I know what the standard deviation is. And suppose that someone actually gave me the standard deviation, right? And then 2 days later, it comes like, hey, oh, do you remember the standard deviation I told you? It is. I was like, yeah. You told me 17. He's like, yeah, I'm sorry. I think I got it wrong. I was like, yeah. Oh, what is it? He said, no, it's actually higher than that. I was like, what? Yeah, it's actually 176. It's 107. I'm like, what? Are you serious? He said, yeah. Okay. So now I have to do the analysis again. And I'm like, okay, well, I'm not too upset because I have a do file and I remember everything, right? Boom. Here's what's happening. Look what happened now. What happened now? What happened now? Again, I'm testing the same null hypothesis, but look what's happening now. Look at the output. What's the p-value and what's the conclusion now based on this?
Very high value.
Right? Right? And so what's the p-value here? I'm testing a two-sided alternative. So what's the p-value? 0.2419. To compare that to 5%, that p-value is higher than 5%. In that case, we fail to reject the null hypothesis, and we conclude that there's no evidence that, and then we conclude that there's no evidence that the mean average age is actually different from 36, right? Okay, roughly. So that's what we have. Now, you see now how your conclusion of an analysis can change depending on what you put in. Right? And so that's sometimes a danger. It's sometimes something you need to be to be concerned with. Right? Okay? Right? Unless you can do this, unless you can justify clearly why this standard deviation ought to be 117 or 170, right? Right? You really have to be careful before you use this, because this is assuming that you know what the standard deviation is. And the result of your analysis depend on that very assumption. So if it's wrong, you might be out of luck. Okay? So you have to be careful. Okay? Does it make sense? Questions? Questions? No? All right. So that was one side. And then of course we can do this for the t-test as well, right? Or we can do this for the t-test as well, where we can have t-test, right? And so the cool thing with Stata, see, I started typing, he helped me a little bit. Now I can type t-test, right? KH, I think is equal to 36, for example. All right. And then I selected, I send it to Stata, and look what's happening now. All right. And so you see here for the difference, right? When I did here the t-test, I did not have to give another value, extra value, right? So the z-test, I have to say what I believe the standard deviation is. And so what that means is my analysis is very much dependent on me getting this right. If I get it wrong, I'm in problem. I have problems. So what it means is somebody else comes, does the same analysis, might get very different result. And sometimes that's not too appealing, right? Okay. Because if I change sigma, if I change the standard deviation, I just get different result, right? Okay. But for the t-test, for example, I don't have to assume the standard deviation. Okay, so that's the difference between the z-test and the t-test. All right. Okay. So remember that both tests make assumption, but essentially for the z-test, you need to make an additional assumption. They all make the very similar assumption. But for the z-test, you need to make an additional assumption about the standard deviation or the variance. Okay? All right? Okay. Any questions within that? Now we're going to move to the fun part now, right? We're going to move to the case where I just show you a case where, I have one group. The problem I'm interested in, I'm just comparing one group. I'm comparing the mean on one group with respect to a fixed quantity, a quantity that I think it is. But that's not always the case, right? In most cases, you will have to compare groups, right? You have to compare groups, right? And Dr. Ninupa talked a little bit about that earlier, where you have placebo and treatment, in most cases, right? You have identified a problem. You think the prevalence of malnutrition is high. How do you address it? If you address it, you will have to compare the answer you got after your intervention, and you have to compare against another group that did not receive your intervention to show that your intervention is actually effective. That's how you show it, right? That's how you show it. So you have to compare two or more groups. Right. So that's what we're going to talk about. We're going to start with the case where we're really interested in comparing two groups. So in many situations, we desire to compare the result of two populations, right? And draw conclusions based on those comparisons. All right. So that's the case of clinical trials, right? Where in a randomized clinical trial, diabetes treatment, we want to determine if the mean blood sugar level is lower in the treatment group compared to that of a control group, right? Is there any advantage, right? Do people who take the treatment have any advantage compared to the people who don't take a treatment? Okay, all right. Or we can decide to look at health disparities, for example. So we may want to compare the average health-related quality of life among two different ethnic groups there. All right. And also yesterday, I think we sort of started to introduce the idea of pair comparison here. So one first case where we can start by thinking about two groups is the case where you can imagine where individuals both receive the treatment and they receive the control also. Okay. All right. Or you can imagine that I'm trying to compare two characteristics where those characteristics are measured on the same individual. The height of mothers, or the hemoglobin level for mothers and hemoglobin level for fathers, right? Is there any indication that, children or adults inherit, some characteristic of hemoglobin level and so on from the parents and the mothers, from the mothers and fathers, for example, right? Okay. And so when comparing the means of two populations, sometimes we examine two variables on the same individual, right? Okay. I look at the weight for children at time 1, and also look at the weight for children at the end of a study. Before the study, end of the study. I want to know if there is any change in weight. Does it make sense? For example, right? Okay. So weight at time 1 is collected on the same individual than weight at time 2. So you have these two variables collected on the same individual, right? Okay. And then the example I use here was the stress level, right? And where I promised we were going to have quiz today, but that's okay. I'm going to have it next time. All right. So, so suppose I'm looking at a group of 60 students there where, you know, I have a measure of a stress level before the test and after the test. I want to know if the stress level is different, right? If there's a difference in the stress level, pre compared to post. All right. I really want to know if test exams tend to raise the stress level of students. That's what I want to know. Okay. All right. So that's a case of pair comparison because again, I'm measuring the stress level pre and post on the same individual, on the same people. All right. Okay. And so to do that, what we often do is to really look at the difference between those two values and then perform a one simple t-test based on the differences between those two values. Okay. All right. And so we proceed as this. So we're going to take the stress level after minus the stress level before for every individual. And then we're going to have those differences we call D1, D. And then we're going to perform a test, assuming that those differences have approximately a normal distribution, sort of symmetric. Then the test now is going to be based on those differences. If there's no difference between the pre and post, then those differences of the scores of a stress level between, if exams has no effect on stress level, what do you expect to see? How do you think pre-exam stress level and post-exam stress level will compare? If there's no effect of exam, so if exam doesn't change my stress level, what do you expect? How would the pre-exam stress level compare to the post-exam stress level? What do you think it is? What do you think it will be? It will be the same if there's no stress level, right? If there's no effect, right? If exam has no effect on the stress level, right? So if you take the difference between those two, you get 0 because they are the same or something close to 0. So that's essentially what we're going to do for the pair t-test. Okay. And so then we take those differences and then now our hypothesis is really related to those differences, right? Pre minus post or post minus pre, whatever you want. Okay. All right. And so again, if those differences are normally distributed, then we can compute our test statistics with t-test, and then we can compute the p-value for that. And once we compute the p-value for it, and then we compare, just like we did before, we compare the p-value to what? To our significance level, alpha. If the p-value is less than alpha, what happened? You what? I want you to get comfortable with this. If the p-value is less than alpha, what happened? We will. If p-value is less than alpha, what happened? We will. We will. If the p-value is less than alpha, what's going to do? What are we going to do with our null hypothesis? Sorry. We will reject the null hypothesis. So every time you hear me ask a question, just reject. Well, probably not reject, but because I might, if the p-value is less than alpha, we're all going to reject the null hypothesis. Whatever the null hypothesis is, whenever the p-value is less than alpha, we are all going to reject the null hypothesis. Whatever the null hypothesis is. Here we're comparing pre and post. So if we reject the null hypothesis, then we can claim that, there's no evidence that the stress level pre and post are the same. Okay. All right. Okay. So, and then we decided to look at a survey there, where we were try to see the education level, compare the education attainment for mothers and fathers. And we're trying to see if there are indication of differences between the education level for mothers and fathers in this survey. And so, of course, we're going to compare the education level of fathers and mothers. If a level of education for fathers and mothers is the same, right, then the difference is what? Is equal to 0, since the education level for mothers is exactly education level for fathers. If you take the differences, then you get 0, since they are the same, right? Okay? All right? And so our null hypothesis here will be the difference in the education attainment, education level for mothers and that of fathers. The difference between those two is equal to 0. So our null hypothesis is that there's no difference in education attainment between mothers and fathers. And the alternative says, oh yeah, there is a difference, right? It could be that mothers have higher education level attainment compared to that of fathers. Okay? And then we'll use a function there to test that. All right? Okay. Now, I do whatever my data is, I do the analysis. This here, I come to your office and I'll show you this output here. What would you say? What do you start to look? Where do you start to look? What do you say? This is a test right here. I'm comparing education attainment between mothers and fathers. This is my outputs. What part of the output are you interested in looking at first? What is it? So this is essentially the same data. This is similar data output we had before, right? In any case, whatever it is, whatever it is, this right here seems familiar. What is the p-value if you have a two-sided alternative here in this hypothesis? 0.02, right? So, I mean, before I even understand the context, right? So once I look at this output here, I know that, oh, this here gotta be, this right here is a p-value. This is essentially, this actually, how we identify the p-value in this data. This right here is a p-value. So whatever it is, what's going to happen here? If my significance level is 5%, what's going to happen? P-value is equal to 0.026. The significance level is equal to 5%. What's going to happen? Or 0.05. What's going to happen here? I will reject the null hypothesis. The good thing is you just need to remember that one direction. Small p-value smaller than alpha, reject the null hypothesis. If not, fail to reject the null hypothesis. That's it. Okay? P-value less than alpha, the significance level, reject the null hypothesis. If it's not that, I fail to reject the null hypothesis. So you only need to remember one direction. Right? Remember that if the p-value is less than alpha, you will p-value less than alpha, you will reject the null hypothesis. You got to say it. So then when you say it, then it stays. Right? You got to say it. Right? Okay? All right. And so then, showing you here some statistics here. The average education attainment level for mothers, for fathers and mothers. And you can see here that of mothers. Education attainment level for mothers is slightly higher than that of mothers. And I'm taking the differences here, and then I'm computing the mean, and then I look at the p-value, I get a small p-value, I reject the null hypothesis, and I declare that there's a significant difference in education attainment between mothers and fathers. All right. Okay. So another way to do this, I can take those differences myself and then look at them. All right. Now, let's look at the case. So the PLT test. Let's recap a little bit. I have one sample. I would like to test the mean. What test can I use? I have one sample. I have one population. I want to test the mean for that population. What test can I use? Give me one. Give me one. I can use a t-test or I can use a z-test, right? Z-test. I can use a Z-test. I can use a T-test. Yes, excellent. Now, I have two groups, right? I have two groups. But those two groups, right, those two characteristics are collected on the same individual, right? What test can I use to know if those two characteristics are different from one another or equal? What can I use? I can use a pair T-test. I have two groups. Pair T-test, two groups. But those two groups are the same. Those two groups are, you know, they are the same. They are two different characteristics collected on the same individual. All right. I want you to remember that, and I'll keep repeating because I know sometimes. All right. So now I want to look at. Now, remember, I want you to keep the picture in mind, right? So I have one group. If I want to test the mean, I have one population. I want to test the mean for that population. I use a Z-T test. Now, I have potentially two groups, two populations. But what's happening is that it's the same people, but just two different characteristics. Example, the weight of the individual, of kids in the beginning of a study, and the weight of the same kid at the end of a study. You see, the weight I have two values for weight for the same kids. Pair T-test. If I want to compare, if I want to know if the weight at the beginning of a study and at the end of a study are the same, I need to use a pair T-test. All right. Now we're going to talk about the case where now I have an intervention, right? I think that if I tell people about how good it is to eat, they will start to eat well. They'll start eating well. So I have an intervention. I have one group that receive the intervention. I have the other one, another group that does not receive the intervention. All right. So there's nobody that belongs to both groups. So they are independent groups, separate groups. So some people receive the intervention where, someone come to visit with them. Hey, you gotta eat well. You can do this. They even get a voucher so they can eat well. And another group that doesn't receive the intervention. And now we want to know if the food consumption, right, increases, is different between those two groups. Does intervention make people eat well? We want to know that. Okay? So these are two different groups now, right? Remember, two different groups. There's no person that belongs to both groups. I want to know that. So in that case, I'm going to use what we call a two-sample independent T-test, right? So now I have two separate group, independent group. Remember, independent group. All right? So we're going to talk about the two-sample T-test there. So there are two independent populations, right? We take a sample from each population, right? And the sample may or may not be the same. They may not be the same. May not be the same, right? May not be the same. Maybe in this group I have 100 people. In this other group I have 80 people, right? I have 80 people here and 100 people here. Might not be the same, but separate group, right? Okay. And the sample size, of course, as I mentioned, may not be the same, right? So now I want to compare the mean. I want to know if those two groups are different from one another. I want to know if those two groups are different from one another, right? That's really what I want. I want to compare those two means there, right? So this sample, we have a simple mean and a simple, what we call simple standard deviation. Remember, these are summary statistics from our data, right? Compare the simple mean, simple standard, simple mean, simple standard deviation, right? Okay. But now, if I knew everything, if I knew the truth, right, which most never do, I would know what the true mean is in each one of those two groups. And really, our interest is to compare mu1 and mu2, the average characteristic in each one of this population. Usually it's the same characteristic. It just happened that we have two different groups, right? Okay. I want to know food consumption in this group, food consumption in this other group. Okay. So assuming that they have the same variance there, I can use a T-test to do that, to compare those two groups. All right. So assuming that I have that, right, we can use a two-sample T-test to do that. All right. And so when comparing people in one group to people in a second group, when these two groups are independent of each other, right, we can use a two-sample test. If the characteristic we're interested in is a continuous measurement, right? It's a continuous measurement, right? Continuous measurement, right? We have to have continuous. Give me an example of continuous measurement. We have Give me a characteristic that we can characterize as being continuous. Give me one on top of your head. Give me one. Which continuous variable you think you have encountered in your work? Nutrition, right? So what's the one you can think about? Quick. What is it? BMI. BMI, right? What else? Weight, height, length, yeah.
Age.
Age, yeah. What else? What else? Education level, yeah, why not? Yeah, that can consider, you can look at that. Continuous, yeah, why not? Okay. All right. What else? Yeah, body fats, right? Body fat mass, right? We can look at that. We can look at H1B level too, right? Iron level, right? That the Nilupa was talking about that earlier, right? Iron level, right? Okay. And so on and so forth, right? So all these are characteristics, continuous characteristics we can look at, right? So the population distribution with parameters are approximately, we're going to assume that there's data, population characteristic, the distribution with population characteristics are actually normal between those two groups there. So let's look at two groups here, right? So here, really what I was looking at here is the body mass here for those two kids, right? Where I'm looking at two groups here, right? I really want to know if there's any indication that the body mass, right, are different between kids who received vaccination, right, who participate in the national polio campaign. Yes or no, right? And so on the left hand side here, right, this here, what is this plot here? We talked about that yesterday. What is it? What is it? This is a, yeah, it has a name. What is it? It's a box plots, right? Box plots. This is a box plot here. Nice, right? So this is a box plot here. And the box plot here, remember I told you it was a way of visualizing data, right? So these are potential outliers here and then so on and so forth, right? Okay? All right. So what is the bar in the middle of the box plot? Remember? That is a, what is it? I heard it. I thought you said it. You had it. What is it? Median? Median, right? Median? Median, right? So these are the medians right here, right? Okay. And so here we're looking at, we want to know if, somehow there's any indication that is, the BMI of kids who participate in the vaccine campaign is different, right? Between people, your kids who participate in the campaign and kids who did not participate in the campaign. Is there any evidence of that? Right? Someone come tells you, you know what? I think when they participate in a campaign, the BMI, the vaccine increase weight, right? Or make the BMI higher, right? Maybe someone can come to, and you get to look at the data. Say, well, is there evidence of that? Right? Okay. All right. So what can we see here? We see that the BMIs here, certainly in terms of the median BMI here for both groups are very close to one another, right? Right? What else can we say? There's a little more variability in this group, right? Do you notice that? Do you see that? A little more variability in this group compared to, right? Compared to the group that participated in a vaccine, all right? So I want to test that. I want to see if there's evidence, right? Is there any evidence that somehow participating in a vaccine campaign, right? Maybe it's a kid who participate in vaccine campaign tend to have higher BMI compared to kids who don't. Is there any evidence of that? That's really what we want to know. All right, so we're going to compare those two groups now, right? Okay? And so we're going to use a t-test there, BMI, and if BMI is less than 40, remember, I told you I had to stream the data a little bit because some of those vary 100, and then I don't think the BMIs ought to be there high. And so we probably can get rid of those while we figure things out. And then we look at those two groups there, and then so how many kids here participated in a vaccine campaign? How many? How many? No, how many kids participated in a vaccine campaign? 156, right? 156 did, and 163 did not participate in a campaign, right? Okay. And so then we look at the difference we test there. And then, so again, I want to test the null hypothesis that there's no difference in terms of BMI between those two groups, right? Namely, participating in a campaign, a vaccine campaign, right? Doesn't, there's no difference in terms of BMI, whether or not kids participate in a campaign, in a vaccine campaign or not, right? There's no difference in those two groups there, right? The two groups here are kids who participate in a vaccine campaign and kids who did not, right? And so the alternative is that, oh yeah, there is a difference between those two groups there, right? I don't care what direction, but there is a difference between those two groups there, all right? And so what is the p-value and what's my conclusion here? What's the p-value? Someone. What is the p-value? 0.65, 0.6596, right? So that's the p-value. What's my conclusion? A what? No. Why? Why I have to reject first? You gotta tell me why. So what's my conclusion? So the p-value is equal to 0.65 compared to what? You compare the p-value to 0.05. The p-value is what? More than 0. So then you fail to reject. Yes, right? You fail to reject the null hypothesis, right? Okay. All right. So that's what we have. And then we're looking at independent. But the test I performed here, right? The test that I did just now assume that the variance between those two groups are the same, right? You assume that those two groups have the same variances. That's really what I assume, right? Okay. There's similar variability in both groups. But when we look at the box plot, we say that, yeah, maybe there's a lot of more variability in one group compared to the other, right? So maybe that assumption is not true, right? It might not be supported by the data, or the data might suggest a little bit of violation of that assumption, right? So what we're going to do, we're all going to perform a test or hypothesis now assuming unequal variances between those two groups. But it turns out that once you do that, the test gets a little bit complicated, but it's fine. Stata does the computation. So Stata will do the computation for us, and then we get a p-value here, which is right around 0.6574. It's not really much different from what we had before, right? And then we reach the same conclusion, right? We fail to reject the null hypothesis again here, and there's no indication that the average BMI between those two groups is, there's not enough evidence to reject the assumption of equal average BMI between those two groups. Okay? All right? We fail to reject the null hypothesis here, right? And so the way you can do this is by using an equal option tells Stata, hey, assume that those two groups have different standard deviations or variances. Okay. All right. Okay. All right. So that's what we have. All right. Now, I just told you that one of the cornerstone with hypothesis testing is that I don't have to believe what you tell me. I can let the data speak for itself. Does it make sense? Okay. All right. Remember, for the case we were talking about earlier, where the BMIs are different, where someone can come and tell you, well, vaccine tend to make those kids a little bit have higher BMI. And you're like, well, wait a minute. I don't have to believe you. Let me look at what the data says. I'll look at the data and say the data says there's really no difference between those two groups. And then you start like, well, wait a minute, but what you say is not supported by the data. Okay. The same thing too. Remember when I did to do the two simple independent t-tests, I have to make an assumption about the variances between those two groups. The first test assume that those variances are the same. The second test assume that the variances are not the same. Who's right? Who's right? Which one is right? We don't know. If we don't know, what do? Hypothesis testing, right? That's exactly what we're doing here, right? So what we're going to do, we're going to compare the variances between those two groups then. Are those two variances the same? All right? So we're going to do that. We're going to do that. And then I don't have to even tell you what this test statistics is. None. But if you look over here, the null hypothesis is what? That the variances are the same, right? The alternative is that those variances are different from one another. What's the p-value and what's your conclusion? Look at this output. It's very similar to what we see. And you will see those output like this. It's very, very similar to one another. Only what changes is the test statistics you will use and then the null hypothesis as well. So based on this is similar to what we've seen before. What do you think the p-value of my test? What would I report as the p-value of my test? And what would be my final conclusion? Think about it. This one is a little bit challenging, but think about it. Very similar to what we've seen before.
Yes.
Yeah. Huh? Think about it. What would it be? What is the p-value? And what's your conclusion? Okay. All right. Let me go back here. Remember this, right? What is the p-value? Where did you get the p-value from?
It's over 0.5.
No. Tell me the value of the p-value. Tell me where you got the p-value from. Where? Tell me the value. 0.674, right? Why? I think what you're looking at is over here is this, right? This notation here is telling you this is a p-value. Sort of the format, that's what Stata uses to report the p-value. I come the next day and I show you something like that. And I tell you, where will you get the p-value? What do you think the p-value is? This is very similar to what we just seen, right? The same output. So the p-value has to be something over here. So the p-value is equal to 0.000. What happened then? Remember, the null hypothesis of this is that the ratio of those two variances is equal to 1. What does it mean? If the ratio of two quantities is equal to 1, it means they are equal to one another, right? So if I take the ratio of two quantities and it's equal to 1, it means they are equal. That's the only time you get 1. Okay. If you have a piece of bread and you divide by whatever, and we all get that one piece of bread, it means there's only one person, like one bread, like one person, right? So 1, like it gotta be. So the only time you get the ratio is because, those two are the same. And so this here, again, is the same idea, it's the same idea with p-value there. So this here is a p-value. And so the null hypothesis is that those variances are the same. The alternative is that the variances are different from one another because the ratio is different from 1. So what does that mean? What will be our conclusion here? We will reject the null hypothesis and conclude that the assumption of equivariance is not supported by the data, right? We reject the null hypothesis here. Okay? All right? Okay? You see, it's the same idea. It's the same idea. And we will do so many tests, but it's still the same idea. Same idea. Small p-value. P-value less than 0.05. We reject the null hypothesis. What's the null hypothesis? Oh, the null hypothesis says this. And then we go back again, right? Recycling, right? Right? Okay. Think. Right. So see, that's what I say. I don't want you to focus on the test statistics, but I want you to focus mostly on the p-value. Focus on that. Focus on mostly on the p-value, right? Because there's so many, it's going to be so many tests, but they all work the same way. If you have a test statistics, there's a p-value. If you have a p-value, then you can say something about the p-value by comparing the p-value to the significance level. You see that, right? Because there's going to be so many tests. This right here is what we call the F test. We're not going to worry about that for now. We're going to see chi-square test. We're going to see so many tests, but they all have the same principle. Every test has a p-value, has to have a p-value. And if you have a p-value, then I need to look at how small the p-value is. If it's smaller than the significance level, I will reject the null hypothesis. If it's not, I don't have evidence to reject the null hypothesis. And that's it. Now, the rest for the technical detail, we'll see that later, right? You'll see that as okay? All right? Okay. All right. So that's a little bit of summary, how to compare, how to do how to compare two groups here. So whenever you want to compare two groups, I want you to be careful, right? There are two things you need to be careful, right? What is it? Whenever you have two groups you want to compare, what you want to know? You want to know if you don't have a case of paired data. Do you have independent group or dependent group? If you have dependent group, what test are you going to use? You're going to use pair or t-test if you have dependent group. If you have independent group, then you're going to use either one of these ones. But that's fine. Then you get to use the independent sample t-test. All right? Independent group, if you have two independent groups, if you have pair, you want to use, if you have dependent group, right? If you have paired data, you want to use paired sample t-test. I will quiz you on this again. Okay? All right? Okay. All right. So now, I'm going to try to extend the same idea now to the case. How am I looking at time? Someone, I got a little bit of time. 2 o'clock, okay. Let's take a break a little bit, walk around. Chicken dance, is that a good time for chicken dance? That's all right? Or no, not yet. Not yet. We can do that? Yeah. All right. Yeah, we take a little bit of break and yeah. Yeah. Probably just for 5. Yeah. I'm just curious, right? Write papers, right? What do you use? You use Word? You use Microsoft Word mostly?
I do, because I have all sorts of collaborators.
Yeah.
Tech or something.
I mean, mine is just turned out to be just a nightmare.
What
So
do you use?
yeah, so usually when I write papers, tech and but then like I have this collaboration thing going on, so like a review paper, and I feel like
Collaboration. Changes and Microsoft Word.
And so the references are my graduate student was supposed to take care of that, and oh my God, like every time I look at this, I'm like, I'm trying not to stress. But it is
The
references are just totally mass, and of course, like you get collaborator, like just people. No, these people now.
I think my students. So I try to get them to use EndNote, but you have to buy it for each user, or you get some group license. So now there's Zotero and it's students.
Yeah.
The collaborators can handle it.
Yeah.
And it's just
Yeah.
just gotta go for the
So
And actually, at the proof level, we realized some of the references are missing. Just
I think you need a reference management software.
and I'm like, so she told me she was gonna handle this. I'm like, I got this. I'm not sure.
I guess the thing about tech is like, yeah, if you have a lot of formulas,
Mhm.
then I mean, that
Yeah,
makes sense.
Yeah.
Because doing formulas and
Man, I'm just, this is
but
just
you
taking.
don't have too many, you can survive that.
Yeah. So we're at this point now, because I don't know much. I think I really need to really get, it really tells me something. I really need to get up to speed so I can catch some of those, I mean, reference managers because I've never done it. So to be honest, I never bother because I'm like, I've never a few papers far in between papers I'm going to write there in Word. But now I'm really like, no, I really need to learn how to, because she the poor thing, I think she's all nervous and just, she get the nervous laugh and I'm like, don't laugh right now. This is rough. So comment was like, no, don't. She's it's a whole mess. Like, and then of course it comes back like, they're like, oh, these references is wrong. I'm like, you told me you were going to do this.
Yeah.
So,
For me, like all my work
Anyway.
is so collaborative
yeah. So you got,
and in different disciplines.
yeah.
And so much of it requires like engineering.
Yeah.
Like it's all
Yeah.
editing, commenting,
Yeah.
editing, and then having a reference management. So you have to, because it's for me, like I work on so many different topics. So it's
Yeah.
like, it's a lot of reference.
Yeah. I'm learning this. Oh,
And
anyway.
so I got attached to, and it's very expensive, but it is like a new student.
Yeah.
And then my students have moved on and just do Sotero. And sometimes it's like charge from a journal. Like it comes and it these are just databases, right? Like it's so the whole thing comes straight from the journal.
Because I mean,
You don't
Google Scout, because mess actually. You look at it's very incomplete.
Okay, so I had a really big crisis with my library, like, because I switched laptops, like my laptop's something really crazy, like something bad happened. And I lost like a big chunk of my EndNote library and I rebuild it. I have 2,726 entries.
So
And
yeah,
that's after the major loss.
wow.
Like I
So
lost 1,000.
so what you have, like you have one that you use everywhere, right?
I
Like
have one library.
so you don't have like different.
Yeah. And so like, it's simple, right? Like, so this part, the actual content of the record
Yeah.
is downloaded directly from the journal and you import it in and it's there. And you can even like attach the PDF. Oh, this one I think.
Yeah.
I'm a little bit lazy about this stuff. So here's one, right? So this is not manually entered. This is just imported from the journal.
Yeah.
And then
That's what I need to.
So then I can just look at the paper.
Yeah.
There's
I've lost it all. All of those that I used to have.
like Sotero or Sotero, right?
Yeah. I used to have like a whole curated thing for my work for the areas I was working in when I was doing my master's and my medical degree, and then I lost all of it.
It's so because then it's a database that's searchable.
Yeah.
And then you link your PDF so you can find your papers exactly when you need it. It's just it will save time.
So that's EndNote, right? That's EndNote.
This is EndNote, which does cost a little bit of money.
Yeah. I
But
think we
there
get it.
are- but like
I think we get it free.
Sotero, that's free.
Yeah. I think you get it free at IU. I think I need to check.
At Purdue, we have to pay.
Yeah.
There was a version, like I forget, like EndNote. I think I had one with EndNote before when it was free. That was when I lost it when it went cost. But also like it's just anything proprietary, right? Anything proprietary, you're at mercy of things changing.
Yeah.
For I think like but people are given, if you're if most people in this room are going to be in there's this position in academia,
Yeah.
then it's worth it to start something robustly.
They should start their library now and like in 10 years,
Start
they'll
building.
have thousands.
Yeah.
If they're reading. They should be full of like, and it's very helpful. And then you just, it's organizing and it's so easy to make references.
Yeah.
And then when you're like, oh no, I'm gonna write to
Because-
the other journal, you just click one thing and it changes it to the other journal.
Yeah.
So if this journal is like number
these guys,
1, 2, 3, and this one is doing like, you know, like it's so
Nowadays, with the way the
Yeah.
data is, it's the only way to do it right.
Yeah.
Manually doing it right is not.
Yeah, no. So
It's just,
I have similar, but in LaTeX, right? So for me, I just stay away from Word for whatever reasons, right? Like, because most of the papers are technical well, I mean technical, like a bunch of formulas and stuff, right? And so, but now, as I'm collaborating with other folks, and then we gotta write, then it's like, oh,
and I'm sorry.
Yeah.
And also, and like,
Like it
but
used to be.
just track changes, like, you have to.
Yeah.
Like there's, with students, like you just have to like, you go over and over and you make comments and you change things and like,
Yeah.
it's just, it's fast and it's documented.
Yeah.
I think it's very.
Yeah, I'm just-
with students.
I just really gotta get out in the. So yeah, anyway, so I think the whole thing started because the reference manager thing, I let my student handle it in Word because I
You can't do it. I mean, I was doing like 10, 15 years ago or whatever, when it first came on because you need something, you gotta do something.
yeah,
Cause
no, totally.
it's, I mean, now the way that data, like the way that papers, like the proliferation,
Yeah, that's so much, yeah,
like the proliferation of information is just,
yeah, no, I mean, just,
like, I mean, I think
And only-
I'm struggling to do it in Word
yeah,
15 years ago. Like I can't even imagine trying to do it in Word now.
no, not at all.
Let's go to the library as an undergrad, like,
Oh, I remember
know?
the stack of,
yeah, like you photocopy things.
yeah.
Like what? It's like I go through like that many in like a day,
Yeah,
right? Like,
yeah.
It's like,
Yeah.
yeah.
That's just for these guys, we're never gonna be big readers, like being able to have a system that doesn't require them to do things manually is right,
And
because the
have-
error rate is so high.
Yeah, you're right.
The time that's required to, it's just so,
Yeah.
the time.
What we have here though is even one step back of like why Word doesn't work or why they need something like that is because people here like oftentimes they're on shared computers, they're on crappy computers, they're on handed down computers. It's like, and so like I'm teaching them to have good habits about backup. That's the whole thing. We just now, like we've just now gotten past the USB drive culture here.
Mhm.
We just turned the corner.
Oh, no, everybody has.
That was good.
But then that's the thing, everybody's used to WhatsApp and you can't search WhatsApp, you know?
Yeah.
So then like we've talked to the people in our team, we're like, don't send files in
Yeah.
WhatsApp, send files by
Yeah.
email. We can search, right?
And
Like just teaching this
Yeah.
stuff, right? Like we're still here.
Yeah. And sometimes I have to adjust because I have friends back home. They want to do everything on WhatsApp. I'm like, no, you're gonna have to send me email. Because it's like, we're gonna send this important document to WhatsApp. Like, what?
Yeah.
No, send me
Because they don't have any sort of culture of searching documents, because they don't have any culture of.
yeah.
So there's no, so we have to explain, like even me, Dr. Lao, like, I think this is why don't put important documents, because you can't search for them, like you can at least go on your desktop.
Yeah.
But if it's gone on a long time,
Yeah.
you can't search, right?
Yeah.
But that's,
Yeah.
just the fact that people are trading like electronic copies is a big step, like
Yeah.
the fact that people are not losing everything to viruses every 18 months is a big step forward.
Yeah.
So this idea of like cultivating something that's for you, that's gonna be for years for you is still,
Yeah.
like here, people have Facebook pages, like have 4 or 5 Facebooks, and then they just like make 4 or 5 Facebook entities and then just cycle them through and then make a new one and then lose 5 again, making one. It's not a culture of like having
Yeah.
your same email for 10, like that kind of permanence and like this, like yes, it's an investment in your time, but it's so good because it's so good and it goes with you.
Yeah.
That way of thinking is
Yeah.
just starting, but these would be the people who would be the early adopters.
Yeah.
Like these are the ones who would get it first here. So
Yeah.
if you're hitting them, you're hitting the right topic for the right people, but it's hard. Even, I mean, they don't have any professionals, right? They're all.
Yeah.
And.
Well, I mean, it's usually really here.
That feels good. Okay. All right. So let's continue a little bit. I'm going to build up a little bit on what we just talked about. And then if you have a little bit of time, I will do a little bit of, I'll do some data, right? So we can see and then, we can chat a little bit. Okay. All right. So far, let's recap a little bit what we did. All right. So if I have one population, right? I have a population, right? I have single population. And somehow I would like to know if the average, the mean characteristic of that population is equal to some value, right? So I have a population, we were looking at the kids there. We got a sample from their population. And we would like to know if the average weight for kids in the population is equal to 36. What can we do? What test can we do? We would like to know if there's evidence to believe that the average weight of kids in their population is actually greater than 36, for example. We want to know if there's evidence that the average weight of kids in their population is above 36. What can we do? We'd like to answer the question. We like to answer that question. We'd like to know if the average age of kids in the population, in a certain population of interest, right? If the average age is actually greater than 36, what do we do?
Category.
Right. We have to do our hypothesis testing. Remember, every time the question is framed, right? Every time the question is framed, right? Every time I want to answer a question, is this that? Is this characteristic this way? I have to do hypothesis testing. I want you to keep that in mind all the time. That's how, because now every time we talk now like scientists. If I ask you something, do you believe that kids in their population, the average age is greater than 36 months? You can no longer yet respond yes or no. You have to say, well, I don't know, but let's investigate. Let's do hypothesis testing. And then you're going to set up a hypothesis testing scenario, choose your null hypothesis, your alternative, and then do a test or hypothesis, right? And then compute the test statistics, compare it to your significance level, and then declare whether or not you reject the null hypothesis, right? I want you to start thinking about it that way. Okay? All right? Does it make sense? Does it make sense, everyone?
Yes.
All right? Every time you have to answer questions, now you can no longer say yes or no. It's not a yes or no anymore. For scientists, it's no longer a yes or no. Is this effective? As vaccine, that the kids who get vaccine have higher BMI. You can't say yes or no more. You have to say, wait a minute. This is a scientific question, right? It's a scientific question. To answer a scientific question, we say in science, you have to go through the 6 steps we talked about. Null hypothesis, alternative, significance level, test statistics, compare your test statistics, p-value, critical value, compare your test statistics, make your conclusion. You got to do it now. All right. Remember the 6 steps we did, right? The 6 steps, right? Hypothesis testing, scientific hypothesis testing, right? Testing, right? The first one is to come up with your null hypothesis. What is your null hypothesis? Right? Null and alternative. Okay? And so that implies that you got to know what the parameter you want to test is. Right? You got to know what scenario you're in. Right? And so once you have that, and then you're going to come up with your significance level. And we call that alpha.
you're gonna have to compute the test statistics. All right. You're gonna have to compute your p-value. Okay. 5 critical value. All right. Those two can be combined, really. Then in 6, you're gonna have to make a conclusion. Conclusion is on p-value and significance level. You see what I'm saying? You're going to have to do that now. Okay? Okay. You have to do that. You have to follow the steps. This is scientific hypothesis testing steps. You have to follow the steps now. Okay? All right? Okay? All right. And in most cases, you have an idea what the null hypothesis is. What is it you want to do? What is it what null hypothesis you want to test, right? You have an idea of that. Here, significance level, you choose to do the significance level. Now, what we've been talking about is over here. What test statistics are we going to use? And the test statistics we're going to use depend on the problem you want to answer. If I have one sample and want to compare the mean, what do? I can use, what are the tests I can use? I have one sample. I can use t-test, z-test. Nice. All right. I can use a z-test and t-test. What's the difference between a z-test and t-test? Standard deviation. Nice. The z-test says, I don't know what the standard deviation is. That's what the z-test says. The t-test says, I don't need to know the standard deviation. It's fine. Okay? The z-test says, I know what the standard deviation is. But if you use it, if you assume you know the standard deviation, you got to know that if you're wrong, then your test is also wrong. All right? Okay? All right? And of course, I'm going to assume in most cases here that your data is normal. You check that, right? You did a histogram of your data. You have an idea is normal. Fine. Okay? All right? Now, it might not be the case. It might not be that you're interested in one population, but you're interested in a setting where you have paired data collected on the same individual. And somehow you want to know if the two characteristics there are similar. What test would you use? You have paired data. You want to compare two groups, but those two groups are paired data. What are you going to do? You're going to do a pair t-test. The pair t-test is taking the differences. All right? Pair t-test. Okay? Now, you want to compare two independent groups. You have intervention, one group that received a treatment, received some intervention, another that didn't. You want to compare those two. What are you going to do? You have two independent groups. You want to compare them. What are you going to do? You're going to use the independent two sample t-test, right? Two sample t-test. Then now for that you have two flavors. One that assumes that the variants are the same. Another one that assumes the variants are different from one another. Okay? All right. Okay. All right. So now I'll talk about one group. The case where you have one group, one population. I'll talk about the case where you have two groups. What do you think I'm going to do next? More than two, right? Why stop at 2? I'm going to do more than 2. That's exactly what I'm going to do now. What if we have more than 2 groups? Right? What if we have 4 groups? Okay. What if we have 4 groups? What if we have 6 groups? All right. So it turns out that at the end of the day, if you have more than 2 groups, you still can do similar things we learned. You can do, you can test those group 2 by 2. Right? You can do 2 by 2 groups like that. You can do that, right? But
we can do that for what we're going to call pairwise comparison, right? So now this formula here tells us if you know how many groups you have, you can determine the number of pairs you will have to do. So if I have 3 groups, how many pair comparison I can do, you think? So if I have 1, 2, and 3, how many pairs comparison? I can do 1 and 2. And I can do, help me? If I have 3 groups, 1, 2, and 3. How many pair comparison do I do? Can I do? I can do 1 and 2. What else? 1 and 3. 2 and 3, yeah. And that's it, right? Because the order doesn't matter. If it's 3 or 3 and 2, it's the same thing as 2 and 3, right? 1 and 3 is the same thing as 1 and 3, or 3 and 1, right? Okay, so that's okay. So that's the number of pair comparison I can make. All right, I can compare 1 and 2, 1 and 3, and 2 and 3. So I have 3. That's exactly what the formula is giving us here, right? So if I have 3 groups, I can make 3 pair comparisons like this. So you can imagine a case where if I have 10 groups, that becomes a lot now. I have to, I'm going to have to stay after 5 when everybody's S is gone to do those tests now. I'll have to do many of them. Okay? So suppose we want to study the weight of student as a function of time at the university, right? So usually it's believed that the longer students stay at school, the more they start to gain weight, because especially in the US, because the food is a little good sometimes at school. So the longer they stay at school, the heavier they get to, right? Okay. So now we like to compare. We like to compare the weight of students across years, right? Year 1, year 2, year 3, year 4. It takes us 4 years, right around. So once you're done with high school, after that, I don't know what high school is. What high school? After, I think high school. What's high school here?
So we had primary school, secondary school,
Yeah.
high school, and university.
High school, right? So after high school, right? After high school, university. For us, university, it takes around 4 years to get a diploma, to get a degree, right? Okay, 4 years. And I think in the French system, it takes probably 3 years to get. So then you can get a license. I think it's licence or something like that. I don't know if you guys know that. But anyway, so in the US, it takes us 4 years, similar to here, right? And so we really want to know if the average weight of students, right, is different across those 4 years. Because remember, we started with the assumption that the longer they stay at school, they start to gain too much weight because they're eating that good food, right? Okay, that's the idea. That's the implication. That's really what we want to test. And so if that's true, if that assumption is true, then what we expect to see is that in high school, they're still at home. So mom say, hey, eat your vegetables. But then when you go to school, first year they're okay. The second year they're home for a little bit. The second year now, so they start to not eat well. And third year, they don't eat well. And fourth year, they don't even eat vegetables anymore. All they eat is junk food, right? Okay, that's sort of the idea. All right. So it turns out that, remember I told you that if you have multiple groups, you can still use what we learned for 2 groups, but you just will have to do multiple tests, right? You have to do multiple tests. Okay? Now, usually, you can imagine if I have too many groups, I will have to do too many tests. If I have 3 groups, I have to do 3. If I have 4, I have to do 6. If I have 5, it keeps going up. Okay? Then I start to get too many, right? If I have 5, I have to do around 20 or 10, no, 10 sets. No, not 20, 10. But it keeps going up. You see that, right? It keeps going up very high. Okay? So, but we really don't want to do that. We don't like that idea. So in this, what we're going to do though, is that we're going to do what's called the ANOVA, analysis of variances. Okay? And the basic idea is really to compare variances, what we call within group and between groups. That's essentially what we're going to do. Okay? That's essentially what we're going to do. So if it's two variances, right? Right? If it's two variances, remember variances is a measure of similarity. Small variance means they are the same. Large variances means that they're very different. So if within variance and between variance are the same, then we're going to conclude there's really no differences. But if they are different from one another, then there is a difference. Okay? So let's start with the basic idea here. So look at this. Let's look at over here, for example. Right? These are those 4 groups here that I have. Okay? These are those 4 groups that I have. What can you say about this? What can you say about the variance over here? Remember, this is the average. This is the average here. Here you have sort of low variances. In each one of those groups, you have sort of low variance. Here you have probably a little bit of high variance, but it's still okay. Not too bad. All right. And so this is the average for across all the groups. So combine all the groups, construct the grain variance. So what do we have? If you look at each group, you have low variances, right? But what's happening is that these groups are very kind of far away from one another, nonetheless. So it means that's very different from one another. Does it make sense? Let's look at here, this now. I have a lot of variance. I don't even know in what group this, compare it to this group here. Compare it to here. I know that the yellow are coming from here, green are coming from here, blue are coming from here. But compared to this here, I can't even tell the difference because everything is sort of mixed up now. Right? So there's a lot of within group variability, but sort of small between group variability. Okay, that's what we call it. All right. So the idea really will be to compute, to characterize the variability in the data within each group, group 1, group 2, group 3, and then between how different those groups are between groups. So how different those groups are. All right. So that's sort of the idea there. And then I'm talking about some of the technical terms, and let's not worry about that. But then the idea is that if I now want to know if those groups are different, whether or not those groups are different, I can copy what we call the F statistics. Remember, I already told you a little bit about the F statistics. But remember, I want you to keep in mind that the statistics doesn't matter. What matters is what? What matters is what? Remember, I told you that earlier. What matters is what? Is the p-value. What is the p-value? Why? Because you will not understand all the statistics. Some of the statistics are very complicated. But every statistics has what? It has a p-value. And that's what we want. Forget the name of the statistics in some cases. In some cases, you don't need. The Z, the T test is fairly easy, but the F test is a little bit complicated. But what you do know is like every human, right? We all have a last name, right? We all have a last name, right? No matter where it is, where you're coming from, it has a name. We all have a name, right? No matter where we're coming from, we have a name. That's the same thing for test statistics. No matter what it is, it has a p-value. I want you to remember that, right? No matter what the test statistics is, it has a p-value. And the p-value is really what you need to know. Okay? All right. All right. So it turns out that we can use the test statistics to compare those groups there, right? And the test statistics has some distribution under the null hypothesis and so on and so forth. Now, let me go back a little bit. So now remember, I have multiple groups. When I had 2 groups, it was only this. Remember that? Well, when I have them 2 groups, the null hypothesis was saying that the average between those 2 groups is the same, or the difference is equal to 0. If they are the same and you take the difference, you get 0, right? Does it make sense? Okay. Now, since I have multiple groups, I'm going to add more mean to it. I'm going to add more values. So because the ANOVA is now testing that all the group have the same mean. Okay. The ANOVA is now testing that. It's now saying the null parties in the ANOVA is that all the groups will have the same mean. When I have 2 groups, I say, oh, those 2 groups have the same mean. If I have 3 groups, I say, oh, 3 groups have the same mean. If I have 4 groups, I say, oh, all 4 of those groups have the same mean. Okay? And then the alternative is that at least 2 of those groups are different. That's all I need. If at least 2 of those groups are different and the rest are not different, it's just fine. If at least 2 of them are different, it's good enough for my alternative. It's good enough for the null hypothesis to not be valid. Okay, either they all are the same or at least 2 of them are different. Okay, all right. Okay, all right. Okay, all right. Okay, now, and then you can, you know, and then, so then let's look at an example to bring it home a little more practically, right? So suppose there's a program there that believes that, hey, you know what? We think that malnutrition is affecting ethnic group more than others. The government, you know, we really want to investigate this and we really want to address it and trying to see how we can bring about, how we can address the disparity that exists between all the ethnic group in Laos, for example. Think about it. That's the problem, right? Okay. Now you are told, well, tell us the evidence, you know, get a presentation together, you know, get a presentation together, we're going to present it to the government. Okay. All right. So you think that the child weight is a good measure of malnutrition, for example, or is a good measure of some health outcome you're interested in weight. And then really, the problem you want to do, the problem you're interested in knowing now, is there evidence that the average body weight of kids in each one of these 5 ethnic groups in Laos, is there any evidence that any one of them is different from the others? Is there any differences between this average weight of his kid, right, within each one of his ethnic groups? Okay, that's what I want to know. That's what we want to know. Gonna have to put a presentation together, take it to the government, and then explain it to them in a scientific way. So this is clearly an ANOVA problem. Our null hypothesis is there's no differences across those ethnic groups. There's none. There's no differences. What's ethnic groups? The body weight of a kid across ethnic groups is the same. There's no differences. There's no reason to believe that there ought to be differences. And then the alternative saying that, well, you know, some groups are different from others. And then we can investigate that later. Right? Okay? That's what we want to test. Is it clear how I frame a little bit of problem, the scientific question we want to answer? Is there evidence that average body weight of kids across those ethnic groups is different from one another? Is there difference across ethnic groups in terms of kids' body weight, infant body weight? All right. Okay. All right. So now we have the data. We have the data from the survey with small data. We know it's not, you know, we think, you know, it's a representative of the sample or the population. You know, due diligence were done. You know, data was carefully collected, and this can give us an idea of what's going on. So what we do, we get a, you know, in our nice report, we have a page somewhere where we throw in summary statistics for the data, right? Okay. And then we have
the average body weight here in kilograms, standard deviation, frequencies, and so on and so forth, right? And so this data set has right around 1162, you know, and then this is a breakdown in each one of those groups there. All right. Does it make sense? So again, we want to compare, looking at those raw data, we'd be tempted to say that, hey, you know, the average body weight for kids coming from the Lao Thai, you know, ethnic group is higher, and so followed by the second group here, and so on and so forth. All right. Again, because you've taken the class here, you came here this week, you quickly know that, because now since you came, you know, since you took this class, you sat in this class, you listened to me for hours, you quickly know that differences does not mean, or mere differences does not mean what? Statistical differences. What we are interested in here, or for most, certainly something you want to defend in front of you know, in front of the government or in the scientific setting, you are interested in statistical differences, or you're not interested in differences. There seem to be differences between these values, but that does not mean statistical differences. And our interest, we are participating, is in statistical differences, which is different from mere differences, like or usual simple differences. Okay, all right, okay. So now, what we're going to do? We're going to run our ANOVA, and then we're going to run our ANOVA, and then once we run the ANOVA, you use the function over here, looking at the BMI less than 40. I want to exclude kids with BMI greater than 40. So, you know, I'm only interested in this, and then I get the value like this. Look at this output. I get a test statistic. What do you think this is? I don't know how I forgot to get the candy when I was coming here, because, you know, so I probably can get people to, all right, so I've thrown the thing, candy, if you get the answer right, right? So what do you think this is? What do you think this is? If you were to guess, after taking this class, after a few slides we talked about, what do you think this is? P-value. This is p-value. You might not quite know what p-value it is, but you know this is a p-value. All right? You know this is a p-value. You know this is a p-value. In fact, this is a p-value for testing our null hypothesis there. Right? Remember, the null hypothesis says what? All the means are the same. Alternative says at least two means are different. So what happened here? P-value is this. What are we going to do? We reject the null hypothesis. Right? We're going to reject the null hypothesis. It seems that the assumption of equal weights across ethnic groups is not quite supported by the data. The data is saying otherwise. Okay? All right? Okay? We reject the null hypothesis over here. Why? The p-value is too small, smaller than 0.05%. Okay? So I'm not going to bug you with all the other details there. So now I've rejected the null hypothesis. So what it suggests is maybe, we don't know, maybe two groups are different from one another. Right? Because remember, the null hypothesis was saying what? That I say there's no differences between those means. I rejected the null hypothesis. That means that the data is not quite, I don't have enough evidence to support the null hypothesis. And then at that stage, I'm left with, okay, well, let me compare those groups then. Let me see what groups are different. So that's exactly what I'm doing here. I'm comparing the means, average weight between Lao Thai and Monk, right? And then I'm looking at each one of these here, the p-values here. What's happening?
What's happened to this? How do I read this? Well, this here, essentially what this is doing is performing a bunch of pairwise comparison. It's comparing, for example, this here is comparing what? It's comparing this ethnic group to this ethnic group. This is comparing this ethnic group to Lao. This is comparing this ethnic group to Lao Thai. This ethnic group, Lao Thai. So on and so forth. Okay? So that I have all combinations here. Okay? Remember I told you that if you have 4 groups, how many pairwise comparison can you make? 6. All right? And then you can see that 1, 2, 3, 4. Oh, here we have 5. Right? Well, how many we have? 5? Is it 5 group or what? This is 4 group. Let me see.
Yeah, we have 5.
We have 5, right? So 5, yeah. So we have 5 here, right? Let me go back. It was 5. Yes, we have 5, right? So 5, we have 10 comparison we can make, right? And that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Does it make sense? So we have 10 comparisons we can make. Not 10 comparisons, 10 comparisons we can make. All right? And then that's really what we're looking at here. All right? What can we say about this p-value here? What can we say about that? Look at this p-value over here. What's happening here? Is this comparison significant?
Not significant.
Is this comparison significant?
No. 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 Only one.
The only one that's significant is this p-value there. This comparison there. So what is the null hypothesis for this comparison? Can you tell me? What's the null hypothesis? Because each one, remember, each one, if you have a p-value, you have a null hypothesis. Right? If you have a p-value, you have a null hypothesis. What's the null hypothesis here? That is that the average weights, body weight of kids, Lao Thai, is equal to Homecoming, the average body weight of kids in Homecoming group. And the alternative is saying that they are different from one another, right? Okay? And then we're rejecting here, since the p-value is small, we're rejecting the null hypothesis. All right? Okay? Now, that's not quite the end of the story, right? It turns out, I want to warn you about something that I did, but I probably didn't tell you right away what I did. You see, it turns out that, remember hypothesis testing, remember I told you when you start your hypothesis testing, you specify your significance level, right? Okay? All right. You specify your significance level, but your significance level you specify is for one test. What do we do? How many tests? How many pairwise tests do we do in this example? You remember? How many do we do? 10. 10. Each one of them, we say the significance level is 5%. But because we're making so many tests now, we have to be careful. If every one of them is 5%, together, they're no longer 5%. Right? And so that brings about the problem of multiple comparisons. I want you to keep that in mind. Multiple comparison. Whenever you're doing multiple tests, you want to be careful about your alpha level. Even if every test has 5%, 10 tests, you no longer have 5%. In fact, you have higher than 5%. Okay? All right? I want you to keep that in mind. So the Bonferroni correction here is to keep the significance level for all the tests at 5% together. All right? So multiple comparison. We're not going to get too much into that, but I want you to keep that in mind. It's you're writing project, you're working on project where you're doing multiple tests, start to think about multiple comparison issues. Okay? All right? Wonderful. All right. So So in summary, right, I've talked about hypothesis testing here, and we try to, I'll try to go over the various tests one can do. I don't pretend it's all a test, but I think those are some of the basic tests you could need. And I think if you follow those 6 steps every time you think about hypothesis testing, every time you ask about the question, a scientific question, maybe don't do it at home. Otherwise, your husband or wife might get, all right, maybe because she won't say yes or no. But certainly at work, you probably want to follow these 5, 6 steps. Okay? Because now, when you are asked questions at work, 9 out of 10 is probably a hypothesis testing scenario problem, right? So you probably want to go through those steps. Or better yet, you can ask the question, is this hypothesis testing problem you asked me or what? All right? Okay. How are we feeling? How are you doing? Good? All right. So, few minutes here. So I think tomorrow what we're going to I'm going to try to do a little bit of practice so we can see a little bit data. But so tomorrow, I want you, when you come tomorrow, right? I want you to think about what the one thing you're going to tell me, right? One thing you're going to tell me that you took away from this class, right? That you kept, it's like, oh, Roger, that's what I remember from this class, right? I want you to think about it. So I want you to start thinking about it, because towards the end, I'm going to call you and then you're going to tell me. Huh? Yeah, that's right. And then I have to find some good candy. Right. That's right. Or chocolate bar. Yeah. Okay. Yes.
It's very clearly random question about value.
No worries. Yeah.
Yeah, it's good for you to answer. How about if you set the significance level at 0.1?
If you set the significance level at 0.1, right? So you could do that, right? You could do that. You could do that, and you just have to say, right? Like, here, I set my significance level at 0.1. That certainly means that, maybe the effect that you capture is not all that, is, that the effect that you got there is not, that the test that you got ultimately is not all that, is not all that powerful. Do you remember that's the point? Because as you're changing alpha, then beta is changing, and then the power is also changing, right? So that's the whole interplay that you got going on there. But otherwise, you can say 0.1. You just gotta be upfront with it. Like, you can't say 0.1. You can, in some cases, I've seen people who are like, well, this is not significant. This test is not significant at a 0.05 level, but it is significant at the 0.1 level. Okay, right? So you just gotta be upfront with it, and then, of course, not by all means look for significance. Yeah, it has to be that.
In what situation that we can set this like that? What situation? What problem that we're looking at? But we can set significance level above 0.1.
Yeah. So.
0.1.
Yeah, but okay. 2 things. I think 2 things. Let me say that. So 2 things. Remember when you said the significance level, right? If you said the significance level, most, people like, or at least, when people publish, most of the time, it's significance level of 5%. It has been a lot of debate about this. Like, why are we choosing 5%? Why are we choosing 5%, right? Why not even 0.001, right? Why are we using 5%? So ultimately, right, what people have come up with is, the idea of 5% is it's not a magical word at the end of the day, right? That all we want you to do is be sure that you've done appropriate statistical analysis. So the appropriate statistical analysis is more important than actually the p-value you got. Now you ask me in what sense, I say in any settings really, you can say if you don't have significance, you just don't have significance at 5% significance. You could say that I have significance at 10%. Now, people, it might just be that the effect you're measuring is so hard to capture that at 5% will be hard to capture the significance. Just true, right? But I've read papers where people, although this is not significance at the 5% significance level, it is significant at the 10% level. It's okay, right? So now, I'm not saying I guarantee it will be published. That's sad that it might not get published, but I think where people trying to move now is what you did correct, statistically sound. And are you honest about what you did? That's what people care more about now than really the significance level. You know, I think there's more push towards like, man, even if it's a null effect, let's publish it. You know, maybe even if it's not significant at 5% of it, let's publish it. Because other people can gain from this. You know, because other people can gain from the way the methodology you went about collecting the data. Because, you know, it's so much they get into the 5%. Before you get the 5%, there's so much stuff you did before. And somebody else can benefit from that. Okay. But that's a good question. Okay. Any questions? Anything else? All right. So if there's none, I think for today we okay. But yeah, think about. Yes.
But yeah, sorry, but this may be individual questions. So I just would like to ask if we have like the two data set that we would like to compare the mean. So we do know or again the first question, the second question is how we adjust the variable or how to do it better. What do you think?
Okay, so first question, say the first question again, sorry.
So we have to merge the two data set together, or
so we have to merge two data sets together.
Or the command that so if we have the two data sets from two forms.
Okay, so two data sets from two different forms.
Different form from different group.
Mm-hmm.
But we would like to compare.
Mm-hmm. Okay, so we have two groups. So we have to make sure that. So two things we need to make sure. We need to make sure that we are comparing apple to apple. So what you have in two data sets, we have to make sure that they are actually comparable. It's the same thing. So for example, because if you want example, you measure one thing and you have an example, in every data set you measure something else, and you want to compare them, then it just doesn't you don't want to do that, right? Because we're not the same. Because really what you want to compare is the same thing you want to compare. And then that you want to compare things so that the only difference in those comparisons are the groups, right? You know, you just have two groups. Otherwise, it's the same characteristic, it's the same body weight you're trying to measure. But if you have body weight in one group and then in the other group, you have some other composite score of body weight, you want to compare them, maybe that's not a good idea, right? But otherwise, if you have two data sets like this and you could combine them and then compare. And of course, when you combine them, you have to create a variable for data set 1, another variable for data set 2, so that you can compare them with respect to the categorical variable that says this data is coming from this data, this other data is coming from the other data. Do you see what I'm saying, right? Okay, you could do that. But the key here is to make sure that what you're comparing is actually comparable. And then also, really what you have here are really